several hours on it. Did you observe whether or not the paramedics in the case did any type of patient assessment with Mr. McClain?
I did not see any sort of assessment on the body-worn camera video.
And were you looking for one?
Yes,
Did you observe them introduce themselves to Mr. McClain?
I did not observe that.
Did you observe the paramedics ask the police any questions about Mr. McClain's condition when they came up to the scene?
I did not.
Did you observe whether or not the paramedics knelt down to Mr. McClain and asked him any questions?
I did not observe them asking him any questions directly.
Did you observe whether or not they brought any tools to the scene?
I recall bringing up that there was might have been a bag that they brought. I didn't see it immediately next to them during parts of the video.
And when you say you did not see it immediately next to them in the video, do you remember now where it was or how far it was from Mr. McClain?
I do not remember how far it was.
Was it close to Mr. McClain?
No.
Did you see whether or not the paramedics used any of the tools that may have been in that bag as part of any assessment with Mr. McClain?
I did not.
Now, in this case, did you form an opinion whether or not you give ketamine, a sedative, when a person has been vomiting?
Judge, I'm going to object again. He's not a toxicologist. So whether they administer ketamine specifically as it relates to this case, his opinion is irrelevant.
Judge, I respectfully disagree. I think as a critical care physician and a doctor who does patient procedures with sedation, he can talk about whether or not you would give a sedation to a person, any person who has been vomiting.
I'll allow that question to be asked.
Did you understand my question, Dr.
Can
B?
you repeat it now?
Sure, absolutely. Let me step back. Did you see in the body-worn camera that there were times when Mr. McClain vomited?
Yes.
And from your observation of the camera, was it obvious that he was vomiting?
Yes.
And were there discussions around the vomiting?
Yes.
Would you give, as a physician, ketamine or any sedative when a person has been vomiting?
No.
Why not?
Because the vomiting causes stomach contents to come up into the throat. And any medicine that alters your level of consciousness and awareness can make it more difficult to ensure that you're coughing and expelling that rather than breathing it in. So it presents a risk of aspiration of that vomit into the lungs.
So I have these 4 words we talked a little bit about yesterday. So you're talking about aspiration, the second word here.
Yes.
In your review of the body-worn camera, did you see whether or not,
Sorry,
that's all right.
I'm just
Do you want me to
taking a look at what you've got up there.
chess terms?
Thank you.
And I apologize to the people in the gallery. I don't know where to put this so you can see. Now, would you, when you're deciding whether or not to give any type of sedative like ketamine, when you don't know a patient's oxygen levels, does that affect your decision whether or not to give a sedative?
Yes.
How so?
It would make one much more cautious. This assessment, without it, it's kind of like driving in the dark with a blindfold on, and just proceeding with a procedure or giving a drug is kind of like hitting the gas when you can't see out your windshield. What you want to do is hit the brakes and slow down. And so without at least some basic assessment, you would not want to proceed.
And you talked a little bit yesterday about the tools that you use. Could you remind the jury, what is the tools you use in order to determine someone's oxygen?
There's a device called a pulse oximeter that we typically would put on the finger to measure oxygen.
In this case, did you see on the body-worn camera whether or not any of the paramedics ever asked Elijah McClain for his weight?
I did not see that or hear that.
Did you see whether or not any of the paramedics ever explain to him their use of ketamine?
I did not hear that, no.
Did you see any evidence on the body worn camera whether or not the paramedics ever asked Mr. McClain for any kind of scent for any kind of medical procedure?
No, I did not.
Now, is the fact that Elijah McClain was restrained by officers, would that have affected, in your opinion?
Your Honor, this witness has no basis to be opining as to what is relevant or not relevant in an assessment in pre-hospital care and implied consent in the pre-hospital care setting. He has no basis for this opinion.
Join, Your Honor.
Response.
I will move on, Your Honor.
All right, please do.
Based on your observation of the body worn camera, did you determine whether or not paramedics had an opportunity to do an assessment?
I believe they did.
And why?
Well, I think, we have to talk about a complete assessment in an idealized sort of in the hospital setting was probably not practical, but components of the assessment, like talking to the patient, assessing at least oxygen levels, awareness, some basic vital signs would be particularly helpful, as well as getting some history, which at least on that body worn camera video, we don't hear any of that happening.
Now I'm going to turn to dosing and ketamine specifically. Do you need an appropriate assessment in order to give a sedative like ketamine?
Yes, you do.
And does that assessment affect the amount of dose that you might give in order to effectively sedate a patient?
It does.
And with ketamine, how is the dose determined?
We would typically use a weight-based dosing, so it's a certain number of milligrams per kilogram of weight.
And can you determine a patient's dosing requirement by giving a visual examination or visual look at the patient?
You typically can estimate weight. So if the dose is 5 milligrams per kilogram, you don't have to determine whether they're 69 or 68 and a half kilograms. You typically can make a reasonable estimation and then dose based upon that. But usually we would, in a patient who could tell us, we would ask them their weight, and we would usually trust that if it matched our visual view. In a hospital setting, we would actually weigh the patient typically.
Because most of us don't look at our weight or view our weight in kilograms, what is 140 pound? How many kilograms is that for a male patient?
You divide by 2.2 to get from pounds to kilograms, so it would be about 64, 65 kilograms.
With ketamine, does the amount of the dose depend, or is it dependent or independent as far as will the more ketamine you give affect the patient or not?
Again, I'm going to object, Judge. He is not a toxicologist. He said generally, this is ketamine impacts the body, and this is a toxicology area, not this expert's.
And Foundation, Your Honor, join.
Response.
Your Honor, once again, based on his prior experience as a critical care physician and as a pulmonologist who does procedures, I think he said he did 700 endoscopy procedures. I believe he can answer what the effects of ketamine is and how sedation, if it's independent or dependent.
Sustain.
Oh, thank you, Your Honor.
Do you know whether or not a dose of any sedative is different, whether it's put into the muscle or done through an IV?
Yes, the dosing is usually different between injecting into a muscle versus an IV.
Now, you said earlier you did not see any conversations between the paramedics and Elijah McClain inquiring about weight. Did you see any conversations between the officers and the paramedics where they had a discussion about the officers' thoughts about weight?
I do not recall any conversation about weight.
In this case, how much ketamine did the paramedics give to Elijah McClain?
500 milligrams into the muscle.
And based on the fact that they gave him 500 milligrams, how much would that translate into Elijah McClain weighing?
About 220 pounds.
And you just previously testified that he weighed 140 pounds.
Yes.
So in your estimation, how much of an overdose was that?
Objection, Your Honor. Terms like overdose, terms as to how much he deserves to have or not have, this is all toxicology. This is not this expert's area.
Join, Your Honor.
Response.
Your Honor, once again, as a critical care physician and as a person in the clinic who is doing these type of procedures with sedation, he can opine about the appropriate amount of ketamine that should have been given to the weight, because this is something he does every day in his career.
Well, I don't know. I haven't heard of any foundation for anesthesiology.
I
Thank
can,
you, Your Honor.
So sustain.
so let's ask those questions.
And it's something the jury can figure out based upon the testimony so far.
I don't know, Judge. I think sometimes math is difficult, but I can ask some questions.
Well,
So,
I sustain the objection.
yes, sir. So based on your experience, can you explain to us whether or not you believe you have the foundation in order to make these determinations?
Judge, I'm going to object and ask that we approach.
Sustain.
In this case, how does 500 milligrams of ketamine relate to your definitions yesterday of awake, conscious sedation, deep sedation, and full anesthesia?
Objection.
Same objection, Your Honor.
Response.
Once again, Judge, I think that he has the experience in his training and what he does for a living in order to talk about these terms and this dose of ketamine based on how the fact that he uses sedation in everyday procedures that he does.
Your Honor, may we approach, please?
Yes.
Based on your examination and observation on the body worn camera, did you make an observation of how ketamine and the use of ketamine affected Elijah McClain?
Yeah, I did.
Can you tell the jury a little bit about before ketamine was administered, what was the condition of Mr. McClain?
Mr. McClain was ill. He was progressively less responsive. So he had a change in his behavior and mental status. Right before the ketamine, he was actually not responding to some of the verbal and other stimuli that were given to him. He was on the ground, and even when there was only kind of light restraint holding him down, he wasn't moving very much. And so there was a stark change in terms of just his behavior that we see and his mental status on the video.
Before the administration of ketamine, do you recall how many minutes had passed since Mr. McClain had actually spoken?
I don't recall how many minutes. It was a progressive decline in kind of the frequency by which he would speak, but also the volume and the amount of what he would say. So it started off as complete sentences, and then he started to maybe say some things that were a little more strange, and then it was more one word, kind of grunts or responses, and that's about where he was before the ketamine.
Before the ketamine, can you describe to the jury what his respiratory rate was?
It's actually very difficult to assess his respiratory rate on the video. We certainly don't see him taking very, very deep breaths, but it is difficult to assess with his clothing and being restrained on the ground.
So we'll watch videos in just a few moments, but before ketamine, can you describe to the jury what Mr. McClain's position is?
He was down on the ground, and sometimes he was with his left side down, lying on his side, and sometimes he was more turned over closer to that prone position where his face was down.
Would a fair and accurate representation, toppled, be a good word for that?
Toppled?
Join.
I'm asking a yes or no question, Judge. It's not leading.
I'll allow the question.
So do you know the term toppled?
And I'm not familiar with how you want to use it here.
Sure, that's fine. So when you're talking that he was closer to the prone position, what position was his right shoulder in?
His right shoulder was more or less up or free.
And where was the position of his head?
It was down on the ground.
Now, right before the administration of ketamine, did you see any type of assessment by the paramedics?
I did not.
At that point in time, based on how Mr. McClain was presenting, would you have expected some questions to be asked?
Yes.
Why so?
Objection, again, he's not a pre-hospital care provider. He can't speak to what assessments a paramedic does.
Join, Your Honor.
I'm going to allow the witness to answer just as far as asking questions.
It would be quite standard to at least engage the patient to explain what you're doing and something basic just to see whether they were responsive, and if so, how much. Because part of what we're doing with sedation is we're trying to alter your awareness, your interaction, and so to some degree, talking to the patient and finding out how that changes after you give the drug is part of your monitoring. So I did not see, at least in the video, that was done.
Did you see in the video that a paramedic gave the sedative ketamine to Mr. McClain?
I saw in the video that he was injected into the muscle with something, and verbally they were discussing that it was 500 milligrams of ketamine.
And once that happened, what happened to Mr. McClain?
So once that happened, within something like 90 to 120 seconds by my count, he became less responsive. Although again, this is sometimes difficult to assess from these videos. But then at around that 2-minute mark, he was being transferred or was transferred onto a gurney. And there we see him not breathing well at all and completely unresponsive.
At that point, after the administration of ketamine, but before he was put on the stretcher or the pram, did you see the paramedics doing any type of assessment?
No, throughout this, I'm sure they have eyes on him, and there is a visual assessment that can be done. But in terms of checking oxygen levels or vital signs, I don't see evidence of that.
At the time that after the administration of ketamine, what is the purpose or the role of monitoring after a patient gets a sedative?
The monitoring is really important because actually, while dose is important with these medications, there's a lot of individual variability. in patients and how they respond. There are factors that even with a good assessment, we might not anticipate, and changes between different types of patients.
Objection, Your Honor. This is non-responsive.
Response.
Just have a different opinions. I think that the doctor did respond to my question. I'm sorry, Judge.
Go ahead.
I asked him about monitoring and what affects it, and he answered the question.
And he's talking about dosing, Your Honor.
Well, I think in the manner that the doctor is answering the question, that I'll overrule the objection.
Based on your own experience, is a visual inspection of breathing sufficient to safely monitor a patient in a sedation procedure?
No, and it's not just my experience. It's clinical evidence, literature, and guidelines and regulations about how we do sedation that require that we monitor.
He's not an anesthesiologist, he's not a toxicologist, and he's not a pre-hospital care provider. He can't speak to protocols, procedures, and requirements of pre-hospital care providers.
Join, Your Honor.
Question asked about in his experience in a sedation procedure is visual inspection alone. So I clearly asked about his experience, Judge.
All right. The doctor has testified about his experience in non-pre-hospital care. To that extent, the court will allow the witness to answer.
So I don't know, I'm not sure how, when you were answering, how much the objection started. So can we just go back? So my question was, in your experience, is a visual inspection of breathing alone sufficient to monitor a sedation procedure?
No, in a clinical setting, we are required to do more than just a visual inspection, because we know that by the time visually somebody's not breathing well, it is often far too late, that we can identify problems with breathing much earlier through the use of monitors like a pulse oximeter or that carbon dioxide monitor called capnography. So that is now required for us in the hospital setting because visual inspection is insufficient.
And in that situation, when there's not monitoring, can there be a risk of serious bodily injury?
Yes,
Can there be a risk of death?
yes.
If a patient is experiencing respiratory failure, what injuries can occur?
Well, if that's recognized quickly enough and prompt intervention to support breathing is done and is successful, sometimes no injury can occur, but a lot of good things have to happen. Sometimes in an emergency, we're able to rescue someone and save their life and recover their breathing. But in doing so, we can injure them in ways like we can damage their mouth or nose or teeth. But the real big concern is that sometimes if it's gone too far and oxygen has dropped too low, it may be that the support comes ineffectively or too late, and then other things can happen. For example, if the breathing is not adequate for too long and the oxygen is low for too long, you could have a heart stop, or you could suffer brain damage or other long-term serious consequences.
And could those consequences, those conditions be serious bodily injury to a patient?
Yes,
Could those consequences lead to death?
yes.
What time frame are we talking about when you have a loss of oxygen that those injuries or death can occur?
It's pretty variable depending upon how low the oxygen is, what other factors the patient has. But this is something that happens in seconds to a few minutes. So maybe somewhere between 20 or 30 seconds and certainly no more than 5 minutes. We can see, the heart stop or cardiac arrest occur sometimes within, 90 to 120 seconds of not having any oxygen.
So a pretty short time.
It's quite quick. And that's why if we wait until there's an emergency, we better act really fast or hope that we get really lucky, or oftentimes it can be too late.
If the respiratory failure continues to more than 5 minutes, What happens then?
Well, one of the more common things that we run into is problems with the heart. So sometimes the heart gets kind of irritable because the heart, like the brain, needs lots of oxygen. And one thing it can do is go into a heart rhythm problem. And sometimes those heart rhythm problems are not immediately life-threatening, and sometimes they are not compatible with life. Some heart rhythm problems mean the pump's no longer pumping, and that's what we would call cardiac arrest. So it can vary, but once your heart is not operating properly, on top of not breathing, then you have a much bigger problem because now you're not delivering oxygen to the body. So it's the heart that we worry about. And in some patients, depending on how low that oxygen is, even if all of that recovers, then we can see either temporary or permanent damage to other organs like kidneys or brain.
After the paramedic gave Elijah McClain the ketamine, do you see evidence that Elijah McClain was in respiratory depression?
On the stretcher, he was not breathing effectively to sustain life, which I would call respiratory depression, heading towards respiratory arrest.
And what signs did you see from Mr. McClain that showed you that?
The way in which he's breathing on that stretcher for some periods of time when we have really good visualization of him and his chest and how it moves. And my experience was something that I commonly see when people are about to stop breathing and are not breathing effectively. He was not using the proper mechanics, and efforts were not effective at expanding his chest the way it needed to be, particularly given the situation where, if anything, he should be breathing more in response to all that he had been through in the prior 10 minutes, not less. And he was breathing maybe less than I am sitting here today, and that was very concerning.
In your opinion, was there still a time between when the ketamine was given and Elijah McClain was on the ground prone and then put on the stretcher? Was there still time to intervene?
Difficult to say, but probably. This is a continuum, so it just continues to happen, and it happens quite quickly. So I think there's a reason to believe, beyond a degree of reasonable medical certainty, that before the ketamine, he was not breathing normally and he was sick, but was breathing adequately to maintain life, and that we could see him, he could verbalize. He wasn't breathing kind of erratically, but then 2 minutes later, we know that he's unresponsive and not breathing adequately. And so somewhere in that time was a time that he was heading to respiratory depression and respiratory failure, and that was an opportunity to intervene. If we intervene, then we can prevent him from stopping breathing and then prevent his heart from stopping.
What about Mr. McClain's position? You have testified that he was more towards the prone position at the time that he was given ketamine. And then they sort of lift him up, they put him on the stretcher, and now he's on his back. What about that change of position or that final position affects respiratory depression?
So the change in position is actually helpful for breathing, in that no longer is there anything pushing him on the ground, or his own body weight actually keeps that left lung from expanding. So to put him on his back allows free chest movement, and he was even sat up to a significant degree to help with that. And so that's good. That helps with breathing. There's also a lot of stimulation, and in a patient who is not very well awake or very sleepy, a lot of intense stimulation can help you breathe. And that was kind of my concern, is that even people who are very deeply sedated with that kind of stimulation would wake up a little bit and breathe more. And yet we see him breathing quite shallowly still.
We see in the video, and we'll watch it in a few moments, some stuff, for lack of a better word, come out of Elijah McClain. Can you explain to the jury at that point what is going on medically with him?
Yes, there's a lot of material that we'll see that comes out of the mouth and even the nose. It's a pinkish fluid. And the concern here is that on the ground, potentially he could have been vomiting. We don't know for sure, but the volume of that strongly suggests to me that he had at least had been vomiting in the past. And sometimes when you reposition somebody, if their throat is full of fluid and because of sedation they were not able to swallow it, it almost kind of overflows. Just like if you have a glass that you tip. We also have to be cognizant that ketamine can stimulate saliva. It can make you make more saliva, which sometimes is good, but in this case can be bad because it can add to the amount of fluid that's up there. And so when we see this pouring out of him as he's leaning forward, we then know that his whole throat is full of this fluid. And yet he's not awake enough to cough or keep this from draining into his lungs because those tubes are right next to each other, and he's not awake enough to cough or protect his airway.
In your opinion, based on your training and experience, how significant is this event on the stretcher?
It was the most significant of all of my review of the video because I had maybe for once a really good look from a medical perspective, but also that was a time that he was clearly in trouble. And if any of us had all of that fluid in our throat and pouring out, we would be coughing like crazy, and he was doing very little of that. So it was very remarkable to me how he was almost not responsive at all, despite what might be some uncomfortable repositioning and that sort of thing, and this amount of fluid that he was not making any intentional effort to breathe or cough or move.
At that point, did you see any paramedics approach him and do something to assist him?
I did not see anyone doing anything necessarily to assist him. It was beneficial to have him sitting more upright, although I recall them pushing him forward, I think, to help with his soft restraints to safely restrain him. So that might have been the reason to push him forward, but that was also kind of helpful for him. But I did not see, anyone, assessing or measuring oxygen or feeling for a pulse or trying to assist the breathing or anything like that.
If we were going to develop a timeline between when the paramedics gave Elijah McClain ketamine and when he has no respiration and pulse, what would that timeline look like?
So I want to be careful that I don't know when he had no pulse. The first time I get a report of that is when he's in the ambulance, which at least to my crude measurement was about 6 minutes or so afterwards. The completely ineffective breathing, I observed the impending respiratory failure, I would call it, on the stretcher occurred about 2 minutes after the ketamine.
So you have just said that really after 5 minutes of not having oxygen, person can have serious bodily injury or death.
Can be 2 or 3 minutes, quite honestly.
And now you're talked about that there's a period of time of up to 6 minutes where no one is monitoring Elijah McClain's pulse or breath. Is that correct?
Correct.
Now, Dr. Buther, how long with no oxygen would result in the heart to stop?
It could just be a matter of 2 minutes, 3 minutes. The heart could stop. Now, Elijah was young and otherwise healthy and was active, and that helps, but it doesn't protect you indefinitely. So in patients that are very frail and have heart disease, sometimes we'll see trouble a little bit earlier and then healthy people a little bit later, but we're talking a single digit number of minutes, 2, 3, 4 minutes at most.
In your opinion, you say ketamine is the primary cause of death. His respiratory arrest and death was significantly contributed to or aggravated by inadequate patient monitoring.
Object to leading, she wants to ask us.
Response?
I'm just trying to set up the next question, Judge.
All right, you'll have to do it in a different fashion.
Why did you conclude that Elijah's respiratory arrest and death was significantly contributed or aggravated by inadequate patient monitoring?
The point that I was trying to make is that regardless of setting, we can give people a completely normal, safe amount of medication, and they can have a bad response. Or we can give people too much medication sometimes. But if we can recognize that there's a problem with the breathing, and if we can both recognize and intervene effectively and in a timely manner, we can prevent a mild problem from becoming a severe problem. And then what you have is a patient who will do just fine, but suffered a minor complication of a sedation administration. So it's almost less about the medication and more about the safe administration of a medication, no matter what it was and no matter what the dose was. That sometimes people react differently, and you have to be ready to support that.
I now want to pivot and go to what was happening in the ambulance. When they load Elijah McClain into an ambulance, was an assessment completed?
There was a lot more evidence of a thorough assessment in the ambulance and documented in the EMS record at that point.
Can you talk to the jury about that?
Yeah, so in the ambulance was when he was formally identified to not be breathing and to not have a pulse. And so he's in both respiratory and cardiac arrest. In other words, his lungs aren't working and his heart's not working. They, at that time, had no pulse, so they had no blood pressure, but they did that assessment and they assessed his breathing, and they were measuring oxygen. And they were doing other things as well, including essentially an EKG or electrical measurement of his heart to understand what might have been going on with his heart as well. So there was starting to be a very sudden and comprehensive assessment in the ambulance.
Now, to make sure that I understand, is this assessment that's finally done 6 minutes, after that 6-minute period of time where we believe that Elijah McClain is
To leading, if she wants to ask what the witness is saying about that, that's fine. Giving it the answer and then asking a question is a leading.
Response.
I will rephrase.
Okay.
Where does that 6 minutes time frame that you just told the jury, where does that fit into what finally happens in the ambulance?
Objection, Your Honor, foundation.
I'll allow it.
So by my accounting, he was given the ketamine, and roughly about 2 minutes later, he had been transferred onto the stretcher and was in impending respiratory arrest and not responsive. And then it was an additional about 4 minutes before he's in the ambulance where they are doing that assessment. So that's 6 minutes from the ketamine to when they're doing this assessment in the back of the ambulance.
Now, at some point, do you find out from observation of the video in the ambulance that the paramedics realize that Mr. McClain is not breathing?
They recognize it, I think, even before that video, in terms of their documentation in the record. And the video in the ambulance is that they're trying to put a breathing tube into Mr. McClain to help with his breathing. They would not have done that unless they first had assessed he's not breathing. So they quickly recognized that that was the major problem to address. And when someone's heart stops, we focus on the heart really first and just kind of support the breathing. But the recognition was this was a respiratory arrest, and that's why they had to hurry up to get that tube down to help support him.
And at some point, through your examination of what was happening in the ambulance or in the ER bay, did they realize that Mr. McClain did not have a heartbeat?
Yes, they realized that in the ambulance that he did not have a heartbeat.
And did they do anything to attempt to get his heartbeat back?
Oh, yes, absolutely. They performed CPR right away, cardiopulmonary resuscitation, where they're pressing on the chest to essentially the heart was not beating. And by doing this, they can force the blood to circulate through the body, because it's not just enough to get the lungs working and the oxygen into the body. You got to get the pump moving that oxygen around the body. So they were they were doing these things all together at once in the ambulance.
And did they actually do a remarkable job in their CPR and getting the heart back?
A remarkably good job.
And so even though they got the heartbeat back, what happens next to Mr. McClain medically?
Yeah, and I think the heartbeat took a long time to come back, and then there might have even been another arrest and return. But they were successful almost immediately at getting the breathing tube into him, which was very impressive, actually, given that situation, which is very difficult. I'm sorry, I may have missed your question.
Okay. So I'm just going to move on.
Okay.
So now I'm going to direct your attention to Elijah McClain's care at the hospital. Based on your review of the records and your training and experience, could anything have been done in the hospital that could have changed the outcome?
I really don't think so. We're always very self-critical and critical of our colleagues, trying to find what could we have done better in a difficult situation. And I feel like from the ambulance to the hospital, and while he's in the hospital, that there wasn't really anything that could have been done better to try to make the best outcome possible for this unfortunate man.
So when you look at the whole time of giving ketamine up to the hospital, when was the point in time, based on your training and experience, that something could have been done?
It was really in that time between the decision to give the ketamine was probably the most important. So right before that, we could have not given the ketamine, or we could have given the ketamine and recognized in that first minute or two that there was excessive sedation. We've slipped to deep sedation or worse. And that first couple of minutes, just before and right after the ketamine, is when intervention would have been most successful.
But it would not have been waiting 6 minutes.
Correct.
Now, I want to go, as a physician, when you're this medical investigator, do you often rule out what happened to a patient in order to determine what you believe is going on with the patient?
Yes, it's often frustrating for patients. We do a better job telling them what they don't have than what they do have, but that helps us narrow our focus to a smaller group of things so that we can help determine what truly caused an incident or is causing an illness.
So when you first began to determine why Mr. McClain died, did you rule out certain medical reasons?
Yes.
So I want to go first to the toxicology report. Did you review that as part of your examination of this case?
I did.
And what did the report tell you?
It looked at a wide range of drugs and medications and found two things. It found the ketamine, which we know.
Objection, Your Honor. I'm going to renew that objection. Foundation is not a toxicologist.
Response.
I believe as a critical care physician and someone who works in a clinic doing procedures, he can describe what he found in a toxicology report and how it affected his opinion.
All right. The court will find that that's pretty common differential diagnosis sort of testimony, so I'll allow it.
And I'll just ask a further question. As part of your normal duties, do you look at toxicology reports or do you consider drug interactions with your patients?
All the time. In fact, that's sometimes why people are admitted to the ICU, is for a toxicology syndrome, and we're responsible for assessing and diagnosing and reviewing toxicology reports.
So from your review from the report, what did you find?
That there was ketamine in his system and there was also marijuana in his system.
Did you consider whether or not marijuana was a contributor to Mr. McClain's death?
Of course, yes.
And what was your final opinion on that?
Well, the most important thing is that we now have a wide experience with marijuana and have seen a lot of people that have been users or toxic, and there's literature to support no real effect on respiratory health. It can change judgment or behavior, but does not affect respiratory drive.
And have you done any research or have any experience determining whether or not marijuana has any indication or interaction with sedatives?
I'm not aware of any interaction, no.
And I'm going to object, that was not responsive to the question. Was there research done or? Was there any writings and publications relied upon?
All right, I'll allow the answer. You'll have a chance to cross-examine on it.
So that answer was no, you don't know of any.
No,
And in this case, do you believe that there was any interaction between the marijuana that was found in Mr. McClain's blood and the ketamine used?
no.
Did you consider whether or not Elijah McClain had some sort of unique allergic reaction to ketamine?
Yes.
And what did you base that on? What did you look at to make that determination?
So there was first of all, we would see kind of different factors clinically. Allergic reactions that are life-threatening often involve the throat closing off and rashes, hives, other sorts of clinical findings, which we didn't see. But then maybe the most important thing is that the autopsy would typically show signs of severe allergic reaction in the lungs or elsewhere in the body. We saw no evidence of that on autopsy.
Now, initially, when you began this examination, did you have a question to yourself whether or not Elijah McClain died because his lungs stopped and he stopped breathing, or because his heart stopped? And what happened first?
Yes, that was really important to try to determine that.
So what did you do, or what records did you look at in order to make that determination?
That was one of the reasons I started with the hospital records, because there was an assessment of his heart. There was an ultrasound of the heart to see how the heart was pumping. The ambulance records showed this EKG tracing and assessment of his heart. And then there was an autopsy report looking at the heart. So that's really helpful at excluding or making far less likely certain heart conditions. Of course, we also have things like his age and his known kind of health status before this, but all of those things are very helpful at assessing whether or not there could be one of many different possible heart problems.
In your opinion, was it that his lungs stopped first or his heart stopped first?
Object to the continuing nature. That's his opinion. That's fine. You can opine and tell us how he got there, but suggesting each of these answers, it's leading.
Judge, I respectfully disagree. I'm asking him a question that he's going to answer, and I'm giving the parameters of the question, but I'm not giving him the answer.
All right, it's awfully close, but I'll allow this question.
So can you tell the jury, in your opinion, whether or not this was a lung issue or a heart issue?
This started off as a lung issue, a respiratory arrest, followed by the heart stopping or a cardiac arrest because of the lung issue and the low oxygen.
And why did you find that?
Well, it's this process of ruling out. When you have a big heart attack, that's from a blockage in one of the three main blood vessels that supplies the heart, you would often see very specific abnormalities in that area being abnormal on heart testing like EKG or the ultrasound of the heart. We did not see that. We saw kind of a global injury to the heart, which is what we typically see in a respiratory arrest. And also 23-year-olds typically don't have heart attacks. We also saw no evidence of blockage on his autopsy in the arteries. There was a discussion of a potentially or question of a narrowed artery that might have been present since birth. But we also had reports that he was an active runner and there was no disease of that vessel. And there was also no evidence on autopsy that had been chronically blocked. So we knew from that that was not significant to be an issue. We worry about heart rhythm problems because sometimes heart rhythm problems do not show anything on autopsy. But how we look at that also is that his rhythm in the ambulance, his heart status in the ambulance was something very much more likely to be related to respiratory arrest. So, I've seen hundreds of people who have arrested and due to lung and heart problems, and the presenting heart status of something called pulseless electrical activity or PEA is very typical of a respiratory arrest and then a heart or cardiac arrest. And while it's not absolutely impossible to say it didn't start as a heart problem, then I go back to what's happened to him. He's vomited, he's aspirated, his respiratory status has declined. He's given a drug that, if anything, stimulates the heart in breathing, but yet his respiratory status declined further. So beyond or to any reasonable degree of medical certainty, my expert opinion had been that this is clearly a respiratory arrest followed by a cardiac arrest. And in medicine, there's no 100%, but all other kind of possibilities that we could have considered were either 100% unlikely or 99.9% unlikely. And so that's where I arrived at that opinion. It was not his heart.
What is the stole?
Asystole
Thank you. I know it's
is the absence of the heart's main squeeze. So systole is when your heart's full of blood, it fills and then it squeezes. And so asystole means the lack of the pump is not pumping. The heart stopped.
And is that something that was happening to Mr. McClain in the ambulance?
Yes,
How do we know that?
because the paramedics report that he has no pulse. But they're and so that's how they're able to confirm that there is no pump, because if there was a pump, you would feel the pulse that you feel in your blood vessels comes from your heart.
And how does that finding affect your opinion whether this is a lung issue or a heart issue?
Well, it's not the only factor, but it makes it much more likely. If we knew just that factor and nothing else, we would make an estimated guess that it's more likely to be a lung issue. But then we have these other factors that make it extremely likely that it's primarily a lung issue.
So did you form an opinion that Mr. McClain did not have a heart attack?
I did.
Now, we've talked a lot about heart attacks and cardiac arrest. They seem like it should be the same thing. Can you explain to the jury what the difference is?
Sure, and heart attack even is not, it's more of a common phrase that in most usage I think means myocardial infarction. And what that means is that there has been some obstruction to blood flow in one or more of the three blood vessels that supply the heart muscle with blood. And that can happen for a number of reasons. It can happen because of a progressive narrowing. It could happen because you have plaque built up in the artery, and that plaque can rupture. There can be a blood clot that forms in the artery, and there can even be a blood clot that comes from somewhere else and lodges itself into the heart artery. And then there can sometimes be spasm of the blood vessel, although that's usually not permanent. And those sorts of mechanisms deplete blood supply to part of the heart. The irony here is the heart's full of blood, but the muscle gets its blood supply from these arteries, not from the blood that's inside. And if you block that briefly or intermittently, you might get chest pain or symptoms like shortness of breath, what we might call angina. If you block it permanently, then the heart muscle can die, and that's what's called a myocardial infarction, or what we would commonly call heart attack. And what that means is that there's a portion of the heart muscle that died. So heart attack is a portion of the heart muscle died.
Any further, it is not a card. General overview, fine, but beyond that, this is for next.
Join, Your Honor.
Does the court want me to respond?
Why don't we come to the bench? Please continue.
based on your review of the record, did Mr. McClain have any of the mechanisms or the reasons for a heart attack that you saw?
No.
All right, Dr. Buther, I want to turn to the video evidence in this case. And when we do that, I'm going to be asking you to talk to the jury a little bit about these conditions that I have written on the board. For the rest of medical conditions are acidosis, aspiration, hypoxia, respiratory depression, and then just ketamine.
Okay.
So, and I'm going to ask you, as we watch the different video clips, to point out to the jury whether or not you think any of these conditions are affecting Mr. McClain at the time that we watch the video.
Okay.
So I would like to start with the Shell gas station, which is Exhibit 127, and it's in evidence. Judge, if we could please turn on the screen.
Judge, can we approach really quickly?
Are we ready? So for the record, this is Exhibit 127, and we're playing 223609 to 223715.
Judge, is there a question?
I'm just letting the jury watch the video.
Judge, the videos are in evidence, so.
All right. All right. If the videos assist the witness in explaining his opinions, the court will allow some leeway, but
Okay, we can pause the video. Thank you. Would the videos assist you in explaining your opinion?
Yes.
Now, at this point, what did watching the video explain to you about Mr. McClain's medical condition?
Well, we clearly aren't fully assessing a medical condition, but we can see that he's not having any trouble breathing or gasping for air, is standing calmly, is interacting normally in terms of this purchase. So it seems that there's some evidence to support that he's breathing normally and behaving normally.
Did you read in the literature or the review of the materials that Mr. McClain may have suffered from asthma as a child?
Yes.
And did you come to a reasonable degree of medical certainty whether or not asthma played a role in this case?
I did.
And did this video inform you whether or not Mr. McClain was suffering from an asthma attack that night?
So this video suggests he's not having some severe asthma attack right now, but this video does not tell me whether he has chronic asthma or suffers from a more lower level chronic symptoms. But for that, it was more based upon history and his medical records, that it wasn't an active problem that he didn't require medication, et cetera.
Now, you had testified yesterday that asthma is one of your specialties.
It is.
Could you just tell the jury briefly what asthma is?
It's a common chronic inflammatory disorder of the airways that causes them to be narrowed episodically and sometimes with exercise, triggered by dry air, cold air, often treated with daily inhaled medication to control the condition. It's a chronic condition. And then for sudden symptoms, short-acting medication. And it can affect any one of us. And so, many of us might have asthma right now and you wouldn't know it from looking. But if you had an asthma attack, you would be struggling to breathe.
And clearly in this video, Mr. McClain is not having an asthma attack.
Correct.
So you mentioned that your review of the medical records informed your decision or your opinion that Mr. McClain was not currently at the time of this video or at the time of this event suffering from asthma. What about those records told you that?
Well, it was the lack of repeated kind of unscheduled doctor visits, emergency department visits, doctor visits for asthma. There had been some asthma history. Also, he was not taking any daily medication for asthma and was reported to have been someone who ran regularly. So he may have had some very mild symptoms, but they didn't require daily medication. And we would say with confidence he did not have persistent asthma based on that.
Did you look at any of the findings from the autopsy that confirmed that Mr. McClain did not die from any asthma-related reasons?
Yes.
And what did you find?
So when asthma is severe and fatal, when asthma kills you and every 3.5 hours somebody in America dies from asthma, it is obvious. There are changes in the airways. They're angry, they're inflamed, the airway is completely closed off and full of mucus, and none of those findings were present at autopsy.
Yesterday, you talked about agitated patients that present in ICU or in your clinic. From your review of the video, how does Mr. McClain's appearance relate to your experience working with agitated patients?
He's not agitated, he appears calm.
Now, at this point, do you see any of the acidosis, aspiration, hypoxia, or respiratory depression in Mr. McClain?
I do not see any signs of those factors.
And just so the jury has an understanding of these terms, can you just briefly describe at a high level what acidosis is?
Acidosis is too much acid in the blood. Aspiration is what we talked about yesterday, where liquid or solid material gets into the lungs inappropriately. Hypoxia means low oxygen level in the body. And respiratory depression means you're not breathing adequately. You haven't stopped breathing, but you're not breathing effectively or adequately.
And at this point, is there any medical conditions that are affecting Mr. McClain?
It doesn't appear so based on this video.
If we were going to write on this chart at the time what the medical conditions were affecting Mr. McClain, I'll just put up here Shell Station. What would you say?
And the best I can tell from the video, normal.
All right, maybe please play in evidence Exhibit 102. That's Officer Rodima's body-worn camera from 22:43:45 to 22:44:15.
Don't hurt me.
Stop.
Let me go of me. No, let go of me.
Chill out.
No, I am an introvert.
Judge, do you mind lowering the lights just a little bit if we can? Thank you very much.
Please respect the boundaries that I am speaking. Relax. Stop. Stop. I'm going home.
Relax, or I'm going to have to change the situation.
Dude, leave me alone.
Sir, can you please
No,
cooperate?
you know,
No, we're gonna talk to you.
started to arrest me, and I was stopping my music to listen. Now let go of me.
Thank you. Now, Dr. Buther, I know we're a little bit in the dark, but at this point in time, do you see anything that's affecting Mr. McClain regarding the these conditions of acidosis, aspiration, hypoxia, or respiratory depression?
No, I do not.
So would you still say he's normal?
Yes.
And what about agitation? Would you describe Mr. McClain at this point as being agitated?
Well, he's no longer calm. You know, there's this interaction and he's talking so we hear some escalation, I guess. I don't think I'd characterize this as agitation, although I don't know what we would call a definition of that, but maybe there's some heightened emotion here.
I would like to play 104, that's Mr. Officer Rosenblatt's camera, from 22:45:08 to 22:48:33.
Stop, dude. Stop, dude. Oh. Give us more. Give us some more. We're fighting them. Stop, dude. You got him? Stop, dude. All right, we got his arms. We got his arms. You want his arms? Yep, we got his arms. Yep. No, not yet. Let go of your arms, dude. Let go of the shoulder. I got him. I got him. I got him. No arm hammer. Go over arm help. Nice and slow. Slow it down. Slow it down. His arm. Wouldn't have fire start. Bring your arm out, dude. Can't get it. I can't get it. Let go of your arm. There we go. People coming, but just start fire. Okay, I've got his other arm. Okay, the other arm. Pop that on. Okay, he's flipping. He's flipping. Dude. Dude, just stop fighting. Taser, taser, taser in a second. You're gonna get tased in a second. Stop fighting. Stop fighting. You're gonna get tased. I got his arm. Okay, hold on. Right, you got that one out. Yep. Stop, dude. All right, get off his chest. Relax. Just relax. 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 Bring that arm back. Let's get him in cuffs. Right arm back. What's his other hand? I got it here. He's in a bar hammer. Stop. Stop. I couldn't breathe. Okay. All right. Side. Straddle him. Figure for his legs. Recover position. Trust me. Recover. I have his legs. Too late to. We got him. Fighting us in the ground. My name's Elijah McClain. We had to use karate. That's what I was doing. I was just doing. Oh, my God. I'm answering for my blueprint. I heard you snoring. I just didn't fight. He didn't lose consciousness. I'm just different. I'm just different. That's all. That's all I was doing. It was actually Rosenberg. I'm so sorry. I have no gun. I don't do that stuff. I don't do any fighting. Why would you fight me? I don't do drugs. I don't even kill flies. I don't eat meat. I'm not vegetarian. I don't judge people. No, I mean, I'm trying to be out and start walking away. I'm trying to, in secret. When we showed him up, and all life, showed up, he was wearing a skate. I respect all life. Walking, so I mean, that's. Forgive me. Yeah. All I was trying to do. I tried. Was become better. We started it because he reached for a roach gun. And we had him on the wall. But I'll do it. I'll do it. All right, what are you going to do?
Thank you, Your Honor. So as part of your review of the body worn camera, did you observe that there was a physical struggle between Elijah McClain and the officers?
Yes.
And is it difficult on the body worn camera to actually see the physical struggle?
Yes, it seems like most of it was not, captured, or at least not captured adequately in this video.
At that point, what is happening medically with Mr. McClain?
Yeah, that was kind of my focus is as him, if I saw this in the emergency department, what would I think? Um, and it's difficult to tell who's making what noise on this, but I feel like we pretty consistently hear some grunting and heavy breathing that could be coming from law enforcement officers or from Mr. McClain. But then he tells us he's having some trouble breathing. The other thing that I noticed is that his voice was clear in that prior video, and during this time it was quite muffled, and then suddenly became more clear. So I think it would be reasonable to guess that the mask was on and that it was off at some point. From a assessment standpoint, I hear evidence of either dry heaves or vomiting, that kind of sound. And I think it's probably reasonable to guess, since we know that he vomited in the mask, that was Elijah making those sounds, not a law enforcement officer. And then to assess kind of mental condition, we don't get a lot of that early on when there's kind of a physical interaction and no words, but then he starts to speak words. And what he's saying seems rational, so he doesn't seem crazy or I don't know what the word would be. He's saying things to try to explain the situation, so it seems that his verbalizations are appropriate. And then from a evaluation of the respiratory status, not only does he tell us he's having trouble breathing, but his words are kind of in short spurts at this point. So he's using 3 or 4 words and then has to take a breath in 3 or 4 words. So that's telling us that he's breathing hard at that time.
So you said that acidosis is too much acid in the blood. Would a physical struggle, what Mr. McClain is having with the officers, cause that?
We know that intense physical struggles cause a degree of acidosis. So probably all of the parties involved have some degree of acidosis immediately after this event.
Can you say to a reasonable degree of medical certainty whether or not Mr. McClain has aspirated at this point?
I can, not directly from that video, but we have audio and video evidence of him having been vomiting. And then we have in the mask evidence of vomit in the mask, which would only occur if he vomited when he had the mask on at the beginning of this. So I think it's to a reasonable degree of medical certainty that the vomiting with the mask on occurred at some point during this time. And when you have a mask on, even though it's not super tight, and some of that can leak out, if you're breathing heavy and you vomit into something around your face, you're going to breathe some of that material into your lungs. So I'm quite certain that he aspirated at least to some degree at that point.
Do you see any evidence of hypoxia or low oxygen at this time?
No, again, we're not measuring, but things like changes in mentation or responsiveness would be a sign of low oxygen, and we don't see that yet.
And how about respiratory depression?
No, if anything, he's breathing more, which would be appropriate.
So this was I skipped a video. So this was at 12:45. What would you say his mental condition is at this point?
I think, maybe anxious but alert and appropriate, and that his breathing has increased.
I'm not trying to be obstructionist, but I'm just going to object to really at some point do this. They have to do it simultaneously, not ask the questions. We watch a video, we then narrate the video, and then we do the timeline. Do it all together.
I didn't know it was we, but at 22:45, not 12:45.
22:45, correct, Judge.
Yeah, you said 12:45.
Thank you very much for correcting me. Judge, I will just say, I think the jury has to have an opportunity to watch the video. I don't want to interrupt them watching the video with asking questions because they haven't seen this.
Okay, we're moving back into the La Brea, but you can, I'll give you some leeway, but we need to move along.
I understand that, Judge. And I'm sorry, Dr. Buther, did you say that at this point that you believe that Mr. McClain aspirated into the mask?
Yes.
And would you say at this point that he has the beginnings of acidosis?
That's likely.
Now, did you hear the officers talk about a carotid hold was applied?
I don't know if I heard that in this video, and maybe I missed it. I heard them issuing some commands and things, but
Do you learn later on that a carotid hold was applied?
yes.
And can you tell the jury at a high level what a carotid hold is?
My understanding is a carotid hold's an attempt to just temporarily cut off the blood supply just to the brain. So there's a brief loss of consciousness and used to help subdue or control someone who might be at risk of harming themselves or others.
And what would that have done to Mr. McClain on a medical level?
Well, usually for a period of just seconds, there's a loss of consciousness. That's kind of the point of a successful carotid hold. And then most people would wake up after 10 seconds or so. So it's a brief way to interrupt behavior or resistance or something like that.
Is there an opportunity for Mr. McClain to experience low oxygen because a carotid hold has been applied to him?
Carotid hold wouldn't change oxygen level in the body, but by design, carotid hold would starve the brain of oxygen. This is very brief, so it doesn't damage the brain, but it does cause this loss of consciousness.
Maybe please play Exhibit 106. This is Sergeant Leonard's video cam from 22:46:38 to 22:47:03.
Still fighting us on the ground. We had to use carotid. I'm different.
He come out? He's out? Was he out?
Yeah. I heard you snoring. He wasn't completely. He didn't lose consciousness.
Yeah.
Trying to get my gun.
At this point, Dr. Buther, do you have an opinion based on a reasonable degree of medical certainty what Mr. McClain's condition is after the carotid hold and the struggle?
Well, now he's awake and interacting and talking, so his mental status seems normal, or maybe he's gotten more anxious or more talkative after this event. He's still having some trouble breathing. You hear him speaking in, again, short bursts of words and breathing heavily.
So at 22:46, based on this video, what would you say his medical condition is?
So mental status is normal. The aspiration had occurred, and he's still having trouble breathing, which can be a sign of aspiration or a sign of acidosis.
Why would a person vomit in this situation?
There are a lot of different reasons. Certainly, stress can cause vomiting, stress alone. So some of my medical student colleagues would vomit before a test. Any pressure on the belly, if you had eaten or drinking recently, particularly if the stomach wasn't empty and you had pressure on the belly, that could cause vomiting. Extreme or severe physical exertion can do this. And what happens when you go swimming or run right after eating is that that all of the blood flow goes to muscles, and you need a lot of blood flow to digest. So your gut needs the blood, but it's starved of blood because it's being used for muscles. And that can cause the stomach not to work correctly. And so vomiting can actually be a direct result of exercise too soon after eating. And certainly there are drugs and medical conditions that can cause vomiting. In this case, I didn't have any evidence of that. So I have to presume that It's something about the physical exertion or the stress of the interaction. There's a thought in medicine that vomiting is a body's way to treat too much acid in the blood. Like if you vomit out the acid from your stomach, that helps balance out acidosis or helps you regulate this. It's not well established. It's true that if you get rid of stomach acid, you can make your acidosis better, but we have no evidence that vomiting is your body's reaction to acidosis. So I think it was probably stress and the physical exertion that caused it.
In the clips that we've seen, did you hear Mr. McClain say something like, "I can't breathe"?
Yes.
How did you take that statement into your opinion regarding respiratory depression?
I don't know whether I would say him saying he can't breathe would be a sign of respiratory depression. I think that's a sign that his body has asked him to breathe more than baseline. And so he's expressing shortness of breath, which can be caused by a lot of different things. But it could simply be that he exerted himself and he's breathing heavily. But it also could be that there's some material in his lungs that are making him feel abnormal. And so it's difficult to say, but he's telling us that he's having to exert more effort to breathe than normal, and he's concerned about it.
Maybe please place Exhibit 104. Once again, this is Officer Rosenblatt's camera, 224833, 224915.
Can you plug my camera?
My camera is no, what you called?
Oh,
I saw him walk in, exactly where he was.
Sacrifice my identity. I'll do it. I'll do it. I guess.
Look at this.
Smaller, phenomenal.
That's great.
We are beautiful.
That's mine.
Neutrality.
He was hitting us.
Excuse me. My son in a mood. Gemini. Oh, so sorry. I'm so sorry. Oh, that really hurt.
And Dr. Buther, was there something about the way that Mr. McClain is talking and the pace in which he's speaking that says something to you about his medical condition?
He's still speaking in fragments, which suggests he's still very short of breath. He's still making sense, but maybe not as much as he was before. So he's starting to get a little bit more tangential, we say, which might mean that he's, maybe he's more desperate and more anxious, or maybe he's starting to get a little change in mental status as a result of his condition.
And when he has a change in mental status as a result of his condition, what does that do?
Well, it can significantly kind of impair his ability to interact with those around him, is maybe the first thing. But it's more of a sign that his medical condition is getting worse. So it's not so much that, he's maybe acting a little less normal, but that could mean that his medical condition is deteriorating. That's the concern potentially.
And what medical condition would be the reason why he's deteriorating?
Typically low oxygen would do that.
And is that hypoxia?
Yes, hypoxia.
So this is 2248. What would you want to say as far as his medical condition based on the clip that you just heard?
I would say short of breath. And, I think at this point, it's still a bit of speculation about whether he has hypoxia. So I might put hypoxia question mark. I think it's something that we need to be concerned about. But at this point, I can't prove that. But I'm getting concerned about it.
Will we please play same video, 104, Officer Rosenblatt, and let's take it from 2250 to 2206 to 2251-34.
Stop. Oh, yeah, I'm sorry. I wasn't trying to do that. I can't breathe correctly because.
Move your camera, dude.
Have the gun?
No, he went for his gun.
Oh, my God.
Does anybody have sandy wipes? All right, thanks.
You can bend his knees a little bit so he can balance himself.
He's kicking around a little bit. So I'm just gonna sit on. Yeah.
Red case? Y'all missing your cell phone?
I'm not missing mine. Are you missing yours? Yours is in the car, right? Your cell phone?
What's up?
Your cell phone is in the car?
I think so. Is it an iPhone?
What kind of drugs did you take?
The red case?
No.
What kind of drugs did you take tonight? What kind of drugs did you take tonight?
Yeah, I'm good, bro.
We need to know, okay?
Good, brother.
Can you find sandy wipes for me somewhere, please?
Know what you're taking.
From anybody? Yeah, anything, please.
Are you listening to me, man? I'm asking you what kind of drugs you're taking tonight.
Now, from this clip, did you form an opinion about what Mr. McClain's medical condition was at this point?
Well, here I think we see more vomiting, or at least dry heaves, this effort to vomit. He was fairly talkative and appropriate at the beginning of that clip, but then was asked questions about drugs and other things, and he didn't seem to be responding as much. So I think there's still this question of whether or not his mental status has taken a step in the wrong direction. He's still short of breath, but there's more episodes of the vomiting ongoing.
Is the fact that he's not being responsive, does that tell you anything about his oxygen level?
Well, it could be that that's, a psychiatric or psychological response to stress, but if he were to have suffered low oxygen, that would cause him to be less responsive. So that's certainly possible.
What about the continuing acidosis? Would he still be experiencing this, or would the body have sort of been able to recover from that?
When you get kind of lactic acid build up from exercise, it takes many minutes to clear, particularly longer if you're not moving. So this is too early for him to have cleared that acid out of his blood.
At this point, do you think that he is experiencing hypoxia or low oxygen?
I think it's possible. I don't know that I'm certain about it yet.
And at this point, do you see him as an agitated patient?
No.
Why not?
Well, I don't hear anything from the officers other than sometimes he's moving his legs or something. And I don't see him providing any sort of extraordinary or irrational physical movement.
So what would you put at this time, being 2250?
I would say he's, in terms of his demeanor, he's calm, still short of breath. Vomiting. And that hypoxia question mark still there.
Did you take into consideration when Mr. McClain says, I can't breathe correctly, that is something to do with his medical condition?
I don't know. I don't want to overinterpret that. That could just mean that he's still saying he's short of breath. In my experience with taking care of patients, when I hear I can't breathe correctly, that's oftentimes there's something else they're trying to say, that something feels different inside of them. So it would be speculation, but if
We don't do that.
we don't want to do that, but it definitely is not as common as just to say I can't breathe, to say I can't breathe correctly. It's interesting. I don't know what it means.
I would like to go to Exhibit 107.
I'd like to go on break.
Absolutely, sir.
All right, folks, we're going to take our mid-morning break at this time. Please recall what I mentioned to you every time we break, and that's don't form or express any opinions or discuss the case. Do no independent research. Avoid any press coverage. I'd like to have you back in roughly 15 minutes. Court will recall 21 CR 2800 and 21 CR 2806. Believe we have the parties in council present. As Joyce indicates that there's a matter that need to discuss prior to the jury coming back. Go ahead.
Yes, sir. Two things, Judge. I'm going to object to Ms. Began's continuing talking objections. I think if she wants to say leading or foundation or relevance, but really speaking in objections is not appropriate in front of the jury. And because she's doing speaking objections, I'm doing speaking responses, and that's not appropriate either. So I would like to stop both of us doing that. And if the court wants more information, we can approach the bench, but I don't think it's appropriate, either one of us, what we're doing.
Okay.
The other thing I'd like to talk about, Judge, is Dr. Buther's expertise and Rule 702. And I've given the court and counsel one case. And just because an expert has a specialty, such as a toxicologist or an anesthesiologist, to answer a certain question, it doesn't mean that they're not the only expert that can talk about that. And yesterday, Dr. Buther talked about that he was actually on the committee for several years that talked about safety procedures on sedation at the hospital. He understands the quality of sedation levels and what he needs to do to protect his patients during medical procedures. And certainly, you know, there may be other experts that can testify to sedation and how drugs affect the body. But as a critical care physician and as a person who works in a clinic and as a person who has training in internal medicine, he also has that training. So it is the people's position that he can give the opinions of the questions that I'm asking. And the case that I just gave the court, HUNTOON, Houghton versus TCI, Cablevision of Colorado at 969 P. Second 681, a 1998 case, says just that. There are no specific requirements as long as there's training and expertise. And so I agree with the court that there could be other experts that could testify to this, but it is the people's position that Dr. Buther has the required training and education and experience to do that also.
All right. Well, I've ruled.
And I've made my record, Judge, so I appreciate that. Is the court going to make a ruling on the leading of the speaking objections?
Well, I think we need to try to avoid them. We should either cite the rule or a specific objection, and then we'll move on from there.
Just to say thanks for the compliment.
All right, we'll bring them back.
Here's entry.
Right, our jurors have returned. Please be seated. We'll recall 21 CR 2800, 21 CR 2806. Parties in council are present. Dr. Buther's on the witness stand, still under oath. You may continue.
Thank you, Your Honor. I'd like to continue playing Exhibit 107, Sergeant Leonard's body worn camera from 2250-22 to 2250-57.
I'm not missing mine.
Hey, man, are you on any drugs tonight, man?
What's that? Your cell phone?
Talk to me, okay?
I think so. Is it an iPhone?
What kind of drugs have you been taking, man?
No.
What kind of drugs did you take tonight? What kind of drugs did you take tonight? We need to know, okay?
Good, brother. You're not in trouble if you're worried about that.
We need to know what you were taking because we need to try to get you treated, okay? Are you listening to me, man? I'm asking you what kind of drugs you were taking tonight.
Dr. Buther, this is a little closer version of the conversation we heard on the past body worn camera, but it's more in the forefront of this clip. Is the fact that Mr. McClain is not responding a concern to you for his medical condition?
Yes.
And why is that?
Well, it's just an abrupt change. And so that means something's going on different and getting worse, not better. Low oxygen is certainly my concern at this point because of his aspiration and his difficulty with breathing in that change in mental status.
So on this second sort of version of this, but at the same time frame, 2250, would you change calm, fitness of breath, vomiting, oxygen, question mark? Would you put anything different here?
I would say less responsive.
And I apologize, but if I could have folks approach real quick.
Thank you, Your Honor. Let's play Exhibit 104. This is Officer Rosenblatt's camera, 2251-39 to 2252-45.
Here you go. Jesus, it's mine. It was recording. I just shut it off because it's split in half. So something fell out right here on the grass, but I don't know what it was.
Probably looks like
Gotta throw up, dude?
Yeah.
Throw up right there, okay? Don't throw up on me, though.
We got fire coming, right?
Yeah. I call him when he first went out.
And I don't think he went out, dude.
He like halfway, I think, but hey, dude, relax.
I think he's trying to puke.
Oh, okay. Get it out, dude. Thanks, bro. Get it out.
You need to swap up, you can take care of that?
Nah, I'm good.
You see, like, there? Anything?
No, we got called to a suspo. He was out here walking around with a ski mask on.
Oh, so y'all need the cell phone picked up?
Probably just
yeah.
bring it over by him, dude. And then, we contacted him. Green. He's wearing
Now, in this clip, we see, what do you see in this clip that is significant for Mr. McClain medically?
Yeah, I think that he's entirely focused on kind of what's going on with his body and vomiting in that clip.
Do you have any opinions regarding his ability to breathe?
He's breathing heavily at that point. We see in the beginning of that clip kind of his whole chest and abdomen breathing much deeper and more quickly than normal.
And regarding his mental status, do you see any change in that?
He seems much less responsive to law enforcement officers.
So in this 2251, what would you write?
That, like the last video, less responsive and vomiting.
At this point, do you see any evidence of respiratory depression?
No.
Let's go and play Exhibit 106. This is Officer Green's body-worn camera, 225509 to 225701. Yes, ma'am.
There you go. Just like that. Don't get up, dude. It's not going to be good for you. I'm telling you right now.
Dude, if you keep messing around, I'm gonna bring my dog out. He's gonna dog bite you. You understand me? Keep messing around.
I think we're okay for here.
Watch your step, dude. You're
Yeah,
right as puke.
it's a little bit.
Dr. Buther, I'm pausing you here right now. Do you see other emergency personnel arriving at this point?
Yes.
And can you tell the jury, based on the body-worn camera, what is the time you see at the top of the screen?
22:55:27.
Thank you.
Yeah.
And then you like bring it
I did not.
Passed out.
Dr. Buther, I had asked you earlier whether or not you observed the paramedics bringing anything to the scene. In this still of this clip, did you see the paramedic bring something as far as equipment?
Yeah, there's that orange or red case. I don't know what that is.
The evidence. Somebody brought it, but I don't think she's substantiated as a paramedic.
Thank you. Did a fire personnel bring something to the scene?
Actually, I don't know who that personnel is. I just see that there's some equipment brought in a case.
You have the pointer still?
Yes,
Could you show the jury what you're talking about?
this right here.
Thank you. May we continue?
Don't do it, dude.
Relax, bro.
Chill out.
Relax.
No, no. When we try to stop him, dude.
Come on. So was he say anything? Did he speak English or anything like that?
He speaks English,
Was it?
but he's definitely on something. He's not having
Okay, at least one success.
Okay.
Stop messing around,
Let's
man.
chill out.
Well, we'll just leave him.
You've already been told several times to stop.
I can't sense myself. Ow! We'll just leave him there until the ambulance gets here, and then we'll just put him down to the gurney. Let me see.
Hey, I know you're busy, but I need to let you know that,
Stop.
we had a suspicious call over here on.
Dude, chill out.
He's got a mask on his face, acting kind of weird. Nothing really criminal. My officers go to make contact with him. He starts acting crazy. They go to head with him. He attacked them. Rosenblatt, he ended up trying to put a carotid on the guy. And actually.
Well, stop fighting us.
Was able to put the carotid on him. They put him out. They were able to get him under handcuffs. We're still struggling with him. I have fire on scene. And that's where we're at. I just want to let you know, yeah, we did that.
At this point, Dr. Buther, what do you see happening medically with Mr. McClain?
Yeah, I don't know what exactly is happening medically. He's making grunting noises. I don't know whether that's a response to pain or whether he's also maybe having some more dry heaving or vomiting. He did speak a clear sentence there about I can't fix myself, so he's still able to get out a reasonable sentence. Curious what that means, but so he's speaking. He might be a little bit more awake and interactive than in the last video, and still struggling with something in that you hear these grunting noises.
Did you hear him say something along the lines of, "I'm trying, please help me"?
Yeah, I did.
And does that inform your medical opinion at all?
I think that and the I can't fix myself is just him trying to communicate his situation, I guess. You know, if he's a patient, he's trying to tell me what's going on, I guess.
And based on your review of all the BWC, the body worn camera, do you know whether or not the statement, "I'm trying, please help me," was his last statement?
I don't know that for sure. I think this is one of the last kind of full statements that we heard from him.
So with Officer Green's body worn camera at 2250, what would you put down as far as his medical condition?
That he's still struggling with breathing and he's making grunting noises. So question whether that's pain or vomiting or both.
At this time, when he says the statement, "I'm trying, please help me," did you see anyone address that?
Objection.
I'll allow it.
That means you can answer the question.
No, I did not.
Let's continue to play this exhibit 105, Officer Green. Can we run till 22:57:45?
Actually applied for audit tonight, so.
Bless you. Thank you.
And the other one, I don't. Oh, you got him? Oh, I didn't know that. Okay, I knew you were busy. And just one other thing we did.
Is this his?
Yeah, that's all his. That's what he was wearing.
It was used, okay. It was very minor.
When the ambulance gets here, we're gonna go ahead and give him.
All the cops are okay.
Perfect, dude.
I appreciate it.
I
Thanks.
don't know what that would be.
Dr. Buther, I'm trying to get a timeline committed. Did you hear on that whether or not one of the paramedics talked about ketamine?
I think I missed that.
Can we go back 10 seconds?
It was used, okay, it was very minor.
So when the ambulance gets here, we're gonna go ahead and give him.
All the cops are okay.
Okay, I did hear when the ambulance gets here, we're going to give him some ketamine.
Can you tell the jury what time we're looking at?
22:57:25.
Perfect, dude.
I appreciate it,
I
thanks.
don't know what that would be.
Whenever he's
Okay,
off,
all right, bye.
he has incredible strength.
Yeah.
Yeah.
Crazy
just
straight ketamine, so.
And I had him in a bar hammer behind his back, and his arm was above his head, and he was still fighting.
Oh.
Is there anybody that can relieve me for a second?
Yeah.
Spitz!
Now, at this point, Dr. Buther, what would you say regarding Mr. McClain being an agitated patient? Do you see that?
Action, Your Honor, leading.
I can rephrase, Your Honor.
All right, go ahead.
Do you see Mr. McClain's physical movements in this clip? Just yes or no?
No,
Do you see Mr. McClain's or hear Mr. McClain's emotional or intellectual status in this clip?
we don't hear very much.
In your opinion, is he an agitated patient in this clip?
Well, just ask the opinion, so overall.
That means you can answer.
No,
He's not an agitated patient.
correct.
Okay, so what would you put at 22:57?
Yes, at 22:57, I guess we can say not agitated.
And remind me, Dr. Buther, when was the statement for we'll give him ketamine?
Or when are you taking notes? I don't remember.
It's around this.
It was around the same time.
Fair to say ketamine is decided to be given.
Correct, yes.
Ketamine decision, is that fair?
Yes,
I would like to continue to play this Exhibit 105, Officer Green's body worn camera, until 22:57:45. Is it? Thank you. I must go down. Then let's play it until 22:00:08.
I'll do somebody to see. Okay. Go ahead, get on for a second. You know, you make the plan.
I kick his legs up and just.
Yeah, well, yeah, if he keeps on, we'll do that.
You seem to be having some difficulties, Judge. I'm sorry, Ms. Kelleher, what did we lose? The jury screen. Works?
I can verify that that works.
My dad told me, don't touch it.
mine is working, so good for me.
All right, looks like it's lighting up again.
So just for the record, we're still on Exhibit 105, Officer Green, body worn camera. Could we continue to play?
I'll do somebody to see. Okay. Go ahead, get on for a second. You know, you make the plan.
I kick his legs up and just.
Yeah, well, yeah, if he keeps on, we'll do that.
Said 2 minutes out.
Okay. All right. We're trying to keep him on his side, dude, but he keeps fighting us, so.
He's breathing. Yeah, still.
Stop, dude, don't do it.
He's been patted down all right.
We haven't even got that far yet, man.
Then he starts going crazy or sweet.
Don't worry about it. Let's keep getting him down.
He's like saying stuff and holding his arms in and he's like, I don't know exactly what that is.
My knee's on his elbow, dude. He ain't going anywhere.
Randy, do you relief?
No, I'm good. I'm just gonna pat him down, make sure he doesn't have anything, because we haven't got to that far yet.
Pull him down.
While he's,
Yes, he pulled his arms in the air. It comes out and
I don't remember feeling. Okay, so it's put it down then. And so it's here. That one.
Well, it is. Okay.
That's all.
I need, yeah, make sure you document that for.
Okay, yeah, 500.
Don't do it.
You're good.
Dr. Beether, we just heard a sound from Mr. McClain. Based on your medical training and experience, what did that sound mean to you?
I think it's likely that that may be another episode of vomiting or attempts to vomit.
Nothing on his legs, right?
No.
I'm gonna come back this way. That way we're not
You-
yelling
you-
at us. Right in his puke.
Oh, thank you.
Here, come this way with it. Come this way. There we go.
What are you trying to get?
Just put his arm down here. And I could drop my knee right on his tricep. And he can't move.
And then he can breathe.
Yep. He can breathe. He can breathe. I just have his arm pinned behind his back. That's it.
At this point, Dr. Beether, what's going on medically with Mr. McClain?
So he kind of remains on this, on the ground, restrained. Sometimes he's kind of starting to fall more face down, and sometimes he's really more on his side. It's actually really hard to keep somebody on their side. But I think medically, kind of as they're moving him back and forth, he's really sedated at this point. There's not very much movement where he had opportunity to move. He's not verbalizing, although during this time they're not asking him a lot of questions. So he seems pretty calm and less talkative. This would be the goal of sedation where he is right now.
But at this point, has ketamine been given?
No.
So why, when you use the term sedation, what are you referring to?
Well, with a patient anyway, like in a hospital context, we're trying to relieve anxiety and calm movement and make people somewhat less aware of what's going on. And so while medicine hasn't been given, this type of person could be cut and pasted into the procedure room, and they would be at the goal of sedation, in that he's not moving around as much as he was before. He's not talking as much as before, and seems much more calm.
What about your opinion regarding, is Elijah McClain an agitated patient at this point?
He's not agitated.
So at this. $2,300, what would you say?
Not agitated. Maybe instead of using the word sedated with the ED, since we haven't given him medication, I might say sedate, SEDATE. Describes more a way of being.
Okay.
Correct.
And I'm going to come back to 2259 in just a minute. Let's continue to play this until 23:03:51. And once again, we're on Exhibit 05, Officer Green, body worn camera.
Don't move your feet. No, don't do that.
So if you take his foot and angle it outwards
Yep.
and put pressure on his ankle,
Well, this is around here somewhere. So just one.
he almost did a push-up with all three of us on his back.
Okay. You want to give that before we?
Yeah, so once he gets out here, I'm gonna hit him in the right shoulder.
Want some shears?
You want shoulder or ass?
Either way, just.
Ass is right here, man.
We'll give that a couple of minutes. We'll see if that works. And then
There
if
you
it
go.
does,
Yeah.
we'll go to bed.
Just keep raising his legs. You good?
Got it? Matt, you guys back away.
Yeah.
Yeah.
I'm kicking you, man.
No, you're good.
Yeah. it's over here.
Okay.
Mine's sticking your head in the ambulance, make.
So I got his arm. Keep your hands. Drag your knuckles right there. You don't have to put pressure until he moves. All right.
We got 500 ketamine? Yep. Awesome, playing too.
Station 520.
Okay. All right.
Just rug her right behind his ear if he fights, all right?
Dr. Ruther, can you tell us the time in which ketamine was administered?
2301:56.
Here we talk to the RP.
We'll give that a minute or two, see if that works. And once it is, we'll go ahead, if you guys are okay with it, we'll uncuff him. We'll go up with the right arm, down with the left, and we'll just restrain everything. We'll give that a minute or two.
All right. Hey, would your, Rosie, here in a minute, once this medicine kicks in, we're gonna uncuff him, put him on the bed.
So I wanted to ask you regarding Mr. McClain's position at the time that administration of ketamine. Are there any concerns from a medical point of view, what position he's in when he is given ketamine?
Yeah, I don't know. He's a little more face down, but his nose and mouth are free, so it's not like there's any obstruction there. But it is a little bit of an odd angle where he would have a little bit more difficulty breathing because he can't really move that left side of his chest that's down. And this video is a little different in that you see several people kind of holding him down at the time, and so that limits his ability to cough or move.
And is it significant from a medical point of view that he's no longer moving and no longer talking?
Well, here I think at the beginning we actually saw him move a little bit more than the video before. So it might be difficult to say sedate when he's moving around there on this section of the video, but definitely less interactive and less movement than we saw at the beginning of the whole sequence.
And based on your training and experience, at this point, does Mr. McClain need ketamine?
No, not based on my training and experience.
What would you like to put at this junction?
I would say, restrained, and mark that around this time he was given ketamine.
I've written restrained and ketamine administered. Is that fair?
Yes, I think in this video we also see that he is still breathing. He's breathing perhaps adequately, we could presume. So we see reasonable efforts to breathe ongoing.
Would it be fair to say still breathing?
Yes.
Can we continue to play this exhibit 105, Officer Green, until 23:03:51?
We're having some problems with the projector once.
And then we're gonna restrain him, soft point him to the bed.
No, you're okay. I got it.
You guys have any extra gloves on you?
My back pouch right here, dude.
Okay.
They're extra large, just so everybody can fit them, but
Just to fill you in, who was contacted by walking down the street wearing like a wrestling mask or something like that. It's like all these guys to get him down and he's ninja. He was pushing. Like no pain compliance, they were completely limited, but still fighting. He's still fighting the week last year. He's super tight, running, back, fighting. So I was excited to know him. That's why I was getting the 5 of ketamine. We have no idea as far as what that's all. So we're gonna give him maybe another minute. It looks like it's starting to kick in.
Yeah, he's snoring.
It's ready. We'll go ahead and uncuff and take him up to you. Is he in custody or?
Yeah,
Sure you will be,
I'm sure he will be, man.
Okay,
Yeah.
fine. Just like the hospital staff know.
if he's not already.
All right. How's he? He seem a little,
Yep.
okay. We'll go ahead and get him on his side and we'll just uncuff him.
Let's get him on the gurney first.
Okay.
If we can.
Okay. You guys want to do that?
You had talked a little bit earlier this morning about his condition after the ketamine and your concerns. Is that what you were talking about this period of time?
Yes.
Overruled.
Did you see anyone, paramedic or otherwise, trying to do any type of assessment during this period of time after ketamine?
Yes, I saw a couple of things here. The first was the verbal comment, he's snoring. The other is someone asked how he's doing, and I heard this kind of slap, slap, slap. And the lack of response, either visually or it is not mentioned. So they did this assessment to see, was there a change after the medication, I presume. And so at this point, he's snoring and not responding to light stimuli, which on that continuum of sedation is deep sedation. So this defines that he's in deep sedation at this point.
And when you talk about deep sedation, what concerns do you have from a medical condition as far as Mr. McClain's ability to be able to protect his airway?
So that's a situation where there's a significant reduction in the ability to cough, get material out of the lungs, or breathe adequately.
And what about the way that he's being given his position on the administration of ketamine? Is there anything about that that you would like to add that you haven't already said?
Well, no, I mean, it's not the worst position. It's not the best position.
So what would you write at 23?
Deep sedation.
Now I want to go back and play at Exhibit 116. This is Sergeant Nunez, body worn camera, 22:59:09 to 23:01:13. It's somewhat of a different angle.
Latima's camera got broken in the middle of all that.
Do we know where,
We already talked to the RP. We got the
Woody's
RP.
camera is?
What's that?
We know where Woody's camera is?
We'll go ahead, if you guys are okay with the one company.
Do you know where your camera is?
No, my camera came off. It's somewhere by.
Oh, it's somewhere down here? Okay.
Probably. Right there.
Okay.
I just,
Hey, would your,
I think it's on.
Rosie,
Yeah.
here in a minute, once this medicine kicks in, we're gonna uncuff him, put him on the bed,
Okay.
and then we're gonna restrain him, soft point him to the bed.
All right.
It is 116, sir. We've already talked about what's happening during this time period, but from this different angle, is there anything that you would like to add regarding Mr. McClain's medical condition?
No.
I want to go back.
Cumulative, if we're going to be showing where there's not.
Response.
That's why I asked if there was anything addition that he wanted to add, and he said no.
All right. Where are we going now?
I'm going to talk a little bit about a statement that Mr. McClain made and ask about whether or not this fits the definition of agitated patient.
And I'm going to object to that.
Overruled.
I would like to play Exhibit 102. This is Officer Rodima's body worn camera,
Where are we?
22:44:15. And I'm sorry, Officer Rodima, if I said Rosenblatt.
You guys.
Take my power back, and I intend to be.
Come on.
Sincere.
Go,
I intend to be simple.
Let your gun, dude.
Stop, dude.
Dr. Buther, what is your opinion as far as Mr. McClain representing as an agitated patient in this clip?
I think it's hard to say, honestly. I feel like if there's ever an argument for agitation, it might be this clip. It seems like everybody is agitated. I don't know exactly what's going on from this video.
And if you had to compare this clip with at the time or right before Mr. McClain was given ketamine, what is the two difference in his behavior?
It's very different. So that could be something we would call agitation. But then right before ketamine, he's restrained, but he's not really moving or talking.
Explain.
So I'm going to come back with my question and ask you from a medical sense, is there a difference between what we just viewed on the clip versus what he was like before he was given ketamine?
Yes, like clinically, there's a big change from someone who appears almost agitated to someone who is not agitated.
May I have just one moment, Your Honor? Now, I want to ask you, you had previously described that your opinion involved aspiration. How does aspiration fit into your opinion regarding cause of death?
Aspiration is kind of an aggravating factor that increases the risk of breathing problems. So the presence of aspiration to some degree increases the risk of administering a sedative medication or doing a procedure. And so it increases the chance that if someone is going to have breathing problems, that they might be worse or more severe.
In your opinion, did aspiration, was it a cause of death for Mr. McClain?
No, it was a contributing factor.
What is the difference medically from a contributing factor to the primary factor?
Yeah, it's a good question. What we mean by that is that that contributing factor by itself was not likely to have caused death, but that it made death more likely when the primary factor, in this case, the ketamine, was administered.
In your opinion, based on the reasonable degree of medical certainty, was acidosis a contributing factor to
Yes.
Mr. McClain's death?
Yes, it was.
Was it a primary factor?
No.
How about hypoxia?
The hypoxia that I presume him to have had before the ketamine was a contributing factor.
Was it a primary factor?
No.
How do you connect respiratory depression with your cause of death?
As a contributing factor. What I'd clarify here is what I'm meaning by this is that when he has impairment in his lungs and is in this position on the ground, he's not able to breathe as adequately as he needs to recover. And that's what I'm calling respiratory depression. Then when he's given ketamine, there's further advancement of that respiratory depression leading to respiratory arrest. And it was the ketamine causing the respiratory arrest to be the primary cause of death.
Do you have an opinion based on a reasonable degree of medical certainty whether Elijah McClain would have been better off if the paramedics had never arrived and given him ketamine?
Rephrase.
Do you have an opinion based on a reasonable degree of medical certainty if the paramedics had never arrived?
I think that's difficult to say because he needed medical attention right there on the ground before he was given ketamine. He needed emergent medical attention at that point. So I would have called 911 if I saw him like that at that moment to try to get some help and get him to a hospital. So I don't think the right answer is to not have paramedics. The right answer was not to give the ketamine.
Dr. Buther, I have no further questions at this time.
Cross-examination.
Good morning.
Good morning.
We're still morning.
Still morning almost.
All right. We have a lot of ground to cover, so I'm going to try to perhaps go back and start a little where we started yesterday. Dr. Buther, I want to go over a little of your primary education and background. My understanding is your clinical interest is primarily, well, what it's held out as is asthma, COPD, and complex chronic airway disorder, correct?
No.
So when that's on the National Jewish website describing what you do for a living, they're wrong?
Correct.
Okay. And the research interest that your employer holds you out as is information systems, is that correct?
No, that's not correct or up to date either.
Okay. So again, your employer got it wrong. Your prior publications, maybe we got this one right. They were in severe asthma, obesity and asthma, body mass plus glucocorticoid response with asthma, and overweight, obesity, and incident asthma. Is that right?
It's not reflective of reality. It's those are publications from over 15 years ago.
Okay.
So it's out of date. That's all. It's accurate, but out of date.
You've never worked as a paramedic, correct?
Correct.
You have never worked on ambulances, correct?
Correct.
You have never worked as an ER doctor, correct?
Not as a, no, I have worked in the ER, but that's part of training, not as an ER doctor.
Right. Right. I mean, as part of your undergraduate, well, medical school training, you do all the rotations and go through all the different areas.
You got it.
So similar to us, you wouldn't want me doing tax advising. So, when you got board certified, we heard you were board certified in pulmonology, right?
Yes.
Critical care.
Yes.
I think there was systematics, something along that.
Informatics, more about systems.
Okay, informatics. And those are the three primary areas you're board certified in. Was there a fourth?
There was a fourth, internal medicine.
That's right. That's the underlying that you initially did your residency in before the fellowship.
Yes.
Okay. And I understood, and it makes a lot of sense, that in medicine, much like law, everything has gotten much more drilled down on specialties, areas of focus these days.
Yes.
So we're seeing, you know, what somebody might have done 50 years ago is general medicine. Today, it's much more honed in and specialized.
Well, we still have general medicine. It's just the extent to which you can carry out that is a little bit more limited.
Sure. So you're not board certified in emergency medicine, correct?
Correct.
You're not board certified in pre-hospital care.
Correct. I don't know if that's even a board certification, but.
Well, I think we'll find out. You're not board certified in anesthesiology.
Correct.
You're not board certified in toxicology.
Correct.
You're not board certified in forensic pathology.
Correct.
You're not board certified in cardiology.
Correct.
And you're not board certified in neurology or neurophysiology.
Correct.
So understandably, at times you may work in these various areas or tangentially, but there are specialists in those areas. National Jewish has a lot of specialists in those areas, and you work together as a team, correct?
We do.
Okay. So when you work up, you said patients come from all over the world to National Jewish, and you work them up and they can have complex situations, right?
Yes.
And they sometimes show up with suitcases full of paperwork so you can help them figure out what's going on, right?
Yeah.
And oftentimes they've been being told for years that their situation is something different than what you ultimately conclude it is, right?
Yes.
And they've been getting medications lots of times for those conditions that they've been being told of for years that they had. And in fact, that was wrong.
Yeah, that does happen.
Yeah. Those doctors that were giving them those medicines, they were trying their best. I think I heard you say, right?
Yeah, there's a mix, but there's some outstanding docs out there who just aren't working in the right environment. And then there's some doctors who maybe aren't. Not everybody gets an A.
Fair enough. That's true. And I bet you got a lot of A's.
Well, I think we can take a mediocre doctor and put them at National Jewish and they do pretty well.
Okay. So you reviewed Mr. McClain's medical history before you gave your opinions, correct?
Yes.
And that included his historical information, right?
Yes.
To the extent it was available.
Correct.
You're aware that shortly after birth, the records reflect that they thought he might have cystic fibrosis.
I remember seeing that. Yes.
That's a very serious lung disease that kills kids. Well, now they make it much further.
Not anymore, thank you.
Yes, we've extended life significantly. But that's a very serious lung situation.
It is.
You were aware that he was diagnosed with a heart murmur at birth and it continued to persist for many, many years, right?
You know, I heard about a heart murmur at birth, but I didn't see detailed records of that being an active problem.
So you heard about it. Who did you talk to hear about it?
I didn't talk to anybody. It was reflected as a historical element in the medical records.
So you read about it?
I read about it.
Okay, fair enough. I misspeak too. So you were aware he has been hospitalized numerous times throughout his youth for asthma, up to 4 times in 1 year.
That was not in recent times.
Fair enough, but you're aware he had been hospitalized numerous times.
Yes.
You were aware that at 13 years old, he was hospitalized. And in those records, they said he hasn't had a lot of consistent care. Fair enough?
That's fair enough.
And that happens. You see a lot of patients where they're not coming in for regular checkups, right?
Correct.
And they're not on medications for whatever the reasons are. People have legitimate and other reasons, right?
If it's active
Mhm.
and they're not on medications, that reveals itself in recent
Sure.
events, right? And if they're not on medications but not having those events, then it's no longer an active issue.
So when he shows up and he's admitted with a collapsed lung, that'd probably be pretty active, wouldn't it?
That's a different type of problem.
So he was admitted with a collapsed lung and asthma. Probably a pretty serious problem.
Yeah, pretty
And
serious.
wasn't on his medicine, right?
I don't recall if you could show me the records of that he wasn't on medications at the time. I don't recall.
If that's what the admission documents say, is there been a history of not taking medication, you wouldn't dispute it, right?
Correct.
Okay. And then we go forward to later teen years, and again, he was hospitalized again with issues surrounding his asthma and no medications. Do you remember that at 17 years old?
Yeah, that was what, 5
Mhm.
years before this event.
Right. So again, there was a period of no treatment, and then again, a serious enough situation to take him into the emergency room.
Yes.
Okay. And in between the last 5 years, there wasn't another hospitalization for anything lung related that you saw, right?
Correct.
Okay. So when you have a history where there is known heart issues, a murmur at birth, and in several of those hospitalizations, there's tachycardia, there is concern. Is that a flag for you? Is that something you should be looking at?
Yeah, that's a misrepresentation. There's no evidence of any significant heart issues in his record.
So in his records, you would say that the presence of the heart murmur showing up throughout his pediatric records is not a significant issue because, in your opinion, it can resolve itself.
No, actually, I'd love to explain what a heart murmur is. It is oftentimes associated with a normal heart.
No, I'm not asking you to explain it. I'm just asking if you would say that does it resolve itself, or it's, in your opinion, it's not something that's something we need to be concerned about.
It's not material. It doesn't sound like it was associated with anything clinical. So it may have resolved, or it may have not been associated with any heart problem.
And presence or absence of tachycardia throughout those hospitalizations could be situational or could be something more. Fair enough?
An expected event to have an elevated heart rate when you're admitted with an asthma exacerbation.
Sure. So you've got a history of some heart things that correspond with some lung things, and a long history of lung things. Fair enough?
Fair enough.
Okay. So when we shift to kind of the present time, weren't you initially contacted by the Attorney General's office to assist the forensic pathologist in identifying whether or not there were some agonal breaths? Isn't that why they reached out?
I don't recall it to be that specific. It was more general, as I recall.
So, and you don't remember it was those 2 breaths on the gurney that you said reflected respiratory depression. You don't remember being asked, are those agonal breaths?
Those were that. So that was my attempt when I was presented with this volume of records to assess. And so I was trying to get a respiratory rate out of it as the doctor. And that one moment was the only time I really had enough information to try to estimate that.
Okay. And your conclusion was those were not agonal breaths.
Correct.
And you said it was, I believe that the respirations were 12 to 15 a minute, somewhere in that range?
Based on
2
breaths. And so my full opinion was that those 2 breaths were a crude estimate, and that was in the context of stimulation, which would drive that up. And that was still very inappropriate because we saw he was breathing 30 times a minute just before.
So actually you did see he was breathing 30 times a minute shortly before, right?
Well, I just saw today, yeah.
Oh, so you, that quickly, just watching it on the video?
I was paying attention to the video, and it looked like it was kind of in the 24 to 30, about every 2 seconds sort of breathing. So he did have some significant, pre-ketamine.
Oh, fair enough. I mean, that's curious because I've got
All right,
7.
hold on.
Oh, sorry.
I'll remind counsel and the witness, I have one court reporter. Do not speak over one another, please.
We're having a conversation that doesn't quite work. Sorry. So we've had 7 different kind of, well, let me back up. You've testified 3 times related to this investigation, right?
I think actually 4 times, once in 2021.
Okay. Well, this being the 4th.
Oh, gotcha. Yes.
Yeah, fair enough. And you've written 3 reports.
Yes.
Okay. And you've gone over the body worn cameras. I don't know if you reviewed them, let me rewind, reviewed them before court this time, but prior to the last court, I think it was at least 10 hours worth of reviewing them.
Yeah, the bulk of that in 2021, and then again earlier in 2023.
Fair enough.
Not before this trial.
Okay. But then either today or today, you were able to just observe and count it and give us a respiration rate, right?
Well, I was curious. I think that was probably not something as accurate, or I don't feel as confident about it to put it down in writing.
Fair enough. But you were able to do it and said a short time before that it was 30. How fast was it?
I'm confident it was more than 15, I guess is my point.
Okay. And when you give somebody medication to help them calm down, it probably is going to slow them down a little bit, right?
Sure.
So I want to talk to you a little bit about some of the stuff you've testified to so far. And I'm going to kind of flip through. You have been out of critical care for 5 years, you said, approximately?
Approximately 5 years, yes.
But you said you do sit on, with the systems, you do a lot of QA and QI. Is that quality, what does that stand for?
Quality assurance, trying to prevent problems, and quality improvement, which is to try to change the system going forward.
Gotcha. And by systems, we mean kind of the whole healthcare system, the medical system? Is that what systems? You're not talking about like a computer system?
That can be part of it, but it's also people and teams.
Okay.
It's a team sport.
Is this historically what it might have been referred to as an M&M?
Not really, no. It's a joint commission requirement
Okay.
that under the medical executive committee of a hospital, you have subcommittees that credential doctors to make sure they're the right people
Sure.
that, do all these different things. And pharmacy committee, this is one of those committees that's required by joint commission.
Gotcha. So what's an M&M?
That's a conference called Morbidity and Mortality, where people review difficult cases or where there's been adverse outcomes to try to share that experience so everyone can learn from it and maybe do better in the future.
Fair enough. That's how medicine has improved so much. Part of how medicine has improved so much is
Yes.
reviewing when there's tragic outcomes or bad outcomes or things of that nature.
Yes.
And that's part of what you do when you're reviewing cases for the hospital, right?
Yes.
And you also testified that you have testified before. Now, I want to be clear with this jury. This is the first criminal investigation you have ever testified as an expert in, correct?
This is the third.
All part of the same investigation, correct?
Correct.
So the first criminal investigation you have ever testified in.
Yes.
Okay. And really, most of the other stuff has been, I think it was one case where you were a fact witness for a patient.
Yes.
So somebody is your patient and you get a subpoena to talk about what they came to you with.
Yeah, that was back in 2011.
Okay. And then other than that, it's been mostly in the area of medical malpractice, which is a civil case, correct?
Correct.
Where there's money at issue and somebody's looking at what's at issue and what happened.
Correct.
Okay. You have never been qualified as an expert in criminal court outside of this investigation.
Correct.
Okay. And when you look at evolving, like as National Jewish looks at how to improve its systems going forward, what are some of the things you factor in? Judge, I'm just going over some of the stuff he was qualified on and information they elicited. I'm not going far down this.
I'll overrule the objection at this point.
That's a very broad question, and I honestly don't know how to answer it.
Okay, so I think you've certainly seen cases at the hospital where there have been bad outcomes. Fair enough?
Response.
Judge, again, I wanted to go into what he put forward and the people elicited in terms of his resume and how it was relevant in this case.
All right. The court will sustain the objection.
Dr. Buther, I believe you were kind enough to share your own experience in a situation where there was an aspiration event in the hospital. Do you remember that? Judge, if we can approach.
Okay.
Dr. Buther, you've witnessed other situations where there have been aspiration events that turn tragic, fair enough? Can
Yes.
you tell the jury about that?
Usually aspiration is something more chronic or not severe, but in settings where somebody is really compromised in the hospital, we've seen where aspiration, we didn't talk yesterday, can turn into a pneumonia, and sometimes a really bad pneumonia. And so most commonly that would be how somebody might die from aspiration as the primary thing. I had mentioned an anecdote of a patient who was at the end of their life, and
Judge, this is how the witness is explaining the differences of how aspiration can end up fatal.
All right, well, the court's ruling at the bench was just down to specifics, and general is okay. We're going into specifics, but go ahead.
Go ahead.
so there can be a wide range of effects, but death is usually a very specific type of patient that has already vulnerabilities, already in the hospital, and then it's an additional insult that that kind of tips them over and they can't recover.
So it can be patients where they're already in pretty bad shape.
If aspiration is the event that then caused their death to happen suddenly, they're usually already in very bad shape.
And even with all the bells and whistles in the critical care unit, you can't save them.
Most of the time we actually do, but sometimes you can't.
Right. And sometimes, even if you can, there's still circumstances where you can't intervene in time. Fair enough?
Yeah, the best way to intervene is to prevent it, I suppose.
Yeah, yeah.
And we focus a lot on that.
If we could have that perfect 40/40 or 20/20 hindsight, right? Dr. I will refrain, Judge.
All right, rephrase.
Dr. Buther, is it fair to say I think you've previously testified, we often know more after an event occurs than we do during the chaos of the moment?
Yeah, sometimes we do.
And that's kind of the role you were thrust into in this case, right? To review after the event what happened.
Correct.
And in doing that, you were given unlimited amount of time to review the case, right?
Yeah, I mean, unlimited might be strong, but you're right. I was given no restriction.
Fair enough. You're human. You have your natural limitations.
Yeah,
Is that fair?
I don't want to do this for a living, if that's what you mean.
And you were given access to whatever you needed in terms of if you asked for it, you were provided access to render your opinions.
Yes.
You were provided access to all of the other experts that the people had retained, correct?
Yes, I didn't have a lot of that with that first statement, but then more came out and I had access to that.
So it's kind of been in process.
Evolving, yeah.
Yes. And and as it's evolved, you've evolved, fair enough, or clarified or added to your opinion.
Well, I think I've been asked questions in different contexts over the last couple of years. So sometimes explanations need to be more focused on certain aspects or deeper or more shallow, depending upon what the question is.
Absolutely. So depending on the question you're asked or the context it's asked in, you may answer it shorter or broader or in more depth.
Yes.
And that's fair enough. So in terms of your opportunity to review the body-worn cameras, it's been nice that you've had unlimited access, right?
Yes, I mean, we can all see we love them to be better quality than they are, but they have been what they've been from the beginning.
Fair enough. As technology evolves, we all evolve. Is that true in terms of your investigation as a medical detective, if you will, to try to piece together? It's one of the factors you factor in as you try to piece together what happened.
Yeah, it's one of the things that we actually are taught in engineering school as well as medical school, that you rarely have all the pieces of information. And that's why hopefully the computers aren't going to come replace us anytime soon.
Fair enough. So you had access to the cameras, unlimited access to to the people's experts, and I think more recently you had access to the physical evidence. Originally, maybe you didn't have access to the physical evidence.
Correct.
Okay. When you talk about how you approach your investigation, you didn't talk to anybody that knew Elijah in life, did you?
I did not talk to anyone, but I had some, I don't remember at what point. I had some interview transcripts, I believe, with friends and or family that
Okay.
discussed a little bit about his life. It wasn't extensive.
Sure. But you didn't personally go and talk to anybody?
No.
Okay. So you reviewed records, medical records?
Correct.
You reviewed transcripts of whoever interviewed these people and it was provided to you?
Yes.
You reviewed the body worn camera footage?
Yes.
Correct. You reviewed the intubation videos?
Yes.
Did you review other things? What am I missing?
I would want to go back to my statements and look
Okay.
at what I've inventoried to have reviewed to be complete and accurate if you need me to do that.
Well, I just was wondering off the top of your head, were there other big ones that jumped to mind? And did you?
University of Colorado medical records.
Okay.
The kind of outpatient records of Mr. McClain, I believe, was Children's Hospital, but some other facility, of his care before this event. There was also a body-worn camera of some of the officers at the hospital, and so there was that. I had images of the X-rays at the University of Colorado. And I'm probably forgetting there was the coroner's report, and then there was a revised coroner's report. The only physical evidence was the mask and the other materials that were associated with that. But I may be missing something, but that's what comes to mind.
Did you have access to the live imaging of different tests that were done while Mr. McClain was in the hospital?
I do not believe I had. If you mean like
the echo, the EKGs, the EEGs, things of that, the live recordings?
So there isn't necessarily such a thing as a live recording for the EKG, but I had that, and I had rhythm strips, which are kind of printouts of ongoing heart rhythm during his resuscitation. Had some of that in the ambulance. The echocardiogram, I had the report, but not the live images, but you wouldn't have wanted to give me the live images because I'm not qualified to interpret live images of echocardiogram.
You had talked, so you generally got kind of the images, and then let me rephrase. When somebody has a test done, there is the test, and then there's a report in the hospital usually. Is that fair to say?
Yes.
So somebody does the test and somebody interprets the test.
Correct.
Okay. And so you had access perhaps to the still images from the test and then the reports. You had all the reports.
So I don't think that reflects
Okay.
this quite accurately. So that's true of the echocardiogram specifically.
Okay.
Right. And I wouldn't have wanted to look at that because I'm not qualified to do that. So I have to rely that an expert reviewed it and provided a report. But for lungs, which is my thing, I didn't just rely on the report. I went back to the actual X-ray, which is a still image. The other area where I had dynamic images was that intubation in the ambulance, which was really useful to see it, not just read about it. And I was, I've been in that situation hundreds of times, and that was really useful to me. So when I have expertise, I go back and try to go to that source image because we like to, not trust anybody, and trust but verify. But where I don't have anything to offer, I did not go back.
Okay.
Does that help you?
I think that's very fair. So what I was wondering was with respect to, for example, the chest X-ray. I think if we could put the chest X-ray up. But we can put them up side by side, please. Thanks, Cole. And we might need to dim the lights. I'm not sure. We'll see.
Yeah, might need to reboot the
The magic box. So you've got the pointer. I believe these are people's exhibits 156 and 157. And doctor, I think you have the laser pointer. Is that fair to say?
I do.
Where's the heart?
So the heart is this big white thing in the center of the chest.
Okay. And I believe you've described it as it's enlarged here.
Yes.
Now, these are taken post at least the first cardiac arrest.
Yes.
Okay. And post all the CPR. We can take them down. Thank you.
And for the record, that's 175 and 176.
All right, 175 and 176 are the exhibits that were shown to Dr. Buther at that point.
Thank you. And Dr. Buther, does the heart get enlarged just by virtue of an arrest?
Yes, almost always.
Okay. Does it get enlarged by virtue of pulmonary edema?
Pulmonary edema reflects fluid in the lungs, and so not necessarily, the heart's not always enlarged, because 50% of heart failure is not associated with a big heart, but a stiff heart. So half the time, I guess we would say yes. And we don't always see it on chest x-ray because it's kind of a crude way to look at the heart.
Right. That's not, if you wanted to definitively say what was going on with the heart, you would not just rely on that x-ray.
Correct.
I mean, it just is a clue. Right?
Yeah.
Okay. You were talking about the intubation video, and I want to be clear. That was done in the ambulance, correct?
Yes.
And there was only one ambulance on site, right?
This is where I'm not an expert in pre-hospital care. I believe there were two rigs. One might have been a fire department vehicle.
Okay.
And the other one might have been an ambulance.
Okay. And that's what I just was clarifying, because I think I'd read that you had said two ambulances. So you were just saying two apparatuses.
Yeah.
Okay.
Yeah.
So it was done in an ambulance, and I believe what was your thoughts of what went on inside the ambulance in terms of trying to save Mr. McClain's life?
Well, I put myself in the shoes of the people that are faced with trying to deal with this. This is one of the hardest situations you can be in. And I've been in that situation where there's a lot of fluid and stuff back there where you can't see very well.
Yeah.
See, in the operating room, if you go to have your gallbladder out, everything looks beautiful and everything's calm and everything is the way it's supposed to be. And it's pretty easy most of the time. This is very difficult. And I was actually almost feeling anxious for them. And they did a great job.
So when you're in that situation and you're looking at that intubation video and they're trying to get the tube down, if you actually watch, you can see CPR is ongoing because you can watch the fluid coming in line with the rhythm, can't you?
Yes, if you're doing it correctly, the whole body is shaking.
Yeah. And in terms of your timeline, you're beholden to the timestamps from the monitors or what was input in the reports, right? That camera didn't have a timestamp.
No, there's this is where the medical record starts to come
Right.
into play, because there's a written medical record, and so the personnel are reporting also times on there.
Well, I would hope nobody would be stopping and timing while they're doing CPR, placing an endotrach and an ios, would they?
So the way this usually,
I will rephrase.
Yes, rephrase. And
Dr. Buther,
refrain from speaking over one another.
Oh.
And just so folks are aware, we need to break at about 5 till I have a meeting I must attend.
I will make sure that happens. Sorry, Your Honor. I'll work with you, Dr. Buther. My opinion is irrelevant. Your opinion is what matters. So with respect to if you're placing an ios, what is an ios?
intraosseous
Explain
access.
to,
So you're probably familiar with when we need to give medicines, we like to get a catheter into the vein called an IV or intravenous line. That helps us get the medicines into the body better than, say, this, oral or through the muscle. But in a hurry, trauma and emergency medicine and critical care have evolved over the last 15 years that you can actually get faster, more reliable access by going right through a leg bone in most cases. And so you can get a catheter and you get medicines directly into the center of the bone, which is It sounds awful, but it's actually been an innovation that's helped us take better care of patients.
So that goes into the lower leg, or usually, but not below the knee.
Typically the tibia and the lower leg bone.
Yeah. Don't test us on anatomy. So lower leg bone. You put the ios in there. You put the endotrach down the throat.
Correct.
Suctions going in the mouth.
If there's suction, yes, usually usually you have that with you to remove some of those secretions.
Well, and in the intubation video, you see the suction tube.
Yes.
Yeah. So that's coming up in the mouth. And CPR, where's that going on?
That's going on in the chest.
Okay. So head, chest, legs, you got it all going on fast.
Yes.
Ideally simultaneously, if you can do that.
Yes.
Okay. So unlikely somebody sitting there timing it out right at that moment, would you say?
Usually the entry to the medical record is after the fact.
In your experience, Dr. Buther?
While I have not been in the field, I've been in this exact situation in the intensive care unit and hospital, and usually somebody is scribbling on a piece of paper or napkin and then entering it in the record later.
So from a hospital-based perspective, when this happens in the critical care unit, everything's going on at once, and then you might have an extra scribe.
Yeah, usually we assign a scribe, and so I don't know what would be the typical standard practice, in this kind of situation, whether there's a person dedicated to entering that or what tools they have to keep track of that. But it did seem that what was in the record was fairly precise.
Okay.
And believable anyway, from what I could look at.
Sure. And just so the juror understands, a medical scribe is what?
Medical scribe is somebody who is by your side and recording what's going on. They're not making medical decisions or assessments.
Right. Would you say it's probably likely that the CCU has a lot more critical care unit, has a lot more bells and whistles available to it than most other settings?
What's the relevance?
It puts in context this witness's opinions because this is his basis of care.
I'll allow some inquiry based upon the earlier testimony on direct.
Go ahead.
So I think it's important that it's different.
Mhm.
Certainly it's not as resource rich as a hospital, but there's training and experience and resources that EMS has that maybe your ICU nurse or doctor doesn't have. So, we work together all the time and we bring different skill sets and tools to the situation.
Fair enough. And in the critical care unit, for example, you have weighted beds, don't you? Some critical care units, not all.
Sure, yes.
So your patient is actually laying on a pram or a gurney or a bed that has a scale built into it.
Usually.
Yeah. Depending on the hospital and its resources, some places may not have that. Fair enough.
Yes.
Is it also your experience that most even outpatient clinics would not have weighted beds? Or do yours?
So weight is not a vital sign, but something we try to get on everybody. And usually that's a scale, or if they're not able to, we actually have ways to weigh people that are in wheelchairs, but we don't have beds in the clinic. So no, we don't have that.
Oh, fair enough. You might have like we would see at a vet's office, maybe like that plate that you can roll up on and it weighs the chair and the person. And
Yeah, we have you can take your power wheelchair and drive onto the scale, which is pretty neat.
Yeah. And then you subtract the weight of the scooter or the wheelchair.
Correct.
Okay. If you don't have those options, you have to eyeball it. Is that fair to say? If you can't ask.
If you can't ask.
Yeah.
Yeah.
And if you don't have family, there to ask.
Correct.
If a spouse comes with their loved one, you can turn to the spouse and ask.
Yes.
So when you talked about patients that come to you from kind of throughout the country and throughout the world, sometimes they come with a family member. Is that fair to say?
Oftentimes they do.
Yeah. And they might even bring their own journal of everything they've been through. So you have a lot of background information. Is that fair to say?
Yes.
And that makes things a little easier, depending on if you can rely on what's in the reports. Is that fair to say?
It's not always easier, actually, because every source of data has its own strengths and weaknesses, and sometimes too much can be too much and make it more difficult.
Fair enough.
But generally, more is better.
It makes me think of the saying garbage in, garbage out. If you're getting bad intel, it might result in a bad decision, right?
Yeah, stereotypically, we have a patient and a spouse, and truth is somewhere in between them.
You hope. So, Judge, before I shift to the next, do you want me to ask a couple more? We're 10 minutes out and I'm going to be shifting into a different area.
Oh, you're about to do that now?
Yeah.
All right, we'll take an early break then, I guess. All right, I'm going to ask the jurors to return at roughly 20 minutes after 1 o'clock. It's now 10 minutes till noon, based upon the clock on the wall. Don't form or express any opinions, discuss the case even amongst yourselves, do no independent research, and avoid any press coverage, and we'll see you back in roughly an hour and a half.
Yeah. I think somebody around the direction.
Jurors have stepped up. Anything before we break?
Mr. Cooper, right?
So Ms. Fagan has been asking a series of questions that doesn't outright talk about mistakes at hospitals and whether or not anyone's at fault, but that's what the questions are hitting at. I think those questions are not relevant, and there's a huge probability of a 4 or 3 problem. And so I'm going to ask that those questions be not allowed from here on out.
All right, well, I was getting about to the end of my rope when we broke. There is a dichotomy in the testimony based upon Dr. Buther's opinions and the difference, I suppose, between, in the field and combat at a clinic or whatever. I think the point's been made, so.
The judge, that's why I said I was shifting than when we broke. I don't believe I have anything else in that area.
Get it to at least shift. Okay, yeah. All right. We're going to take a break for a few minutes. Trying to get we can be off the record, but obviously the projector is not working very well, so we're trying to remedy that. It may very well be the projector itself, which is worth a lot more than my truck. So we're going to plan.
I can have it set up.
Yeah, well, that's probably a good idea. I was thinking about maybe starting a little later on Monday, like 9 or 9:30, just so we can get a backup plan put together for the, from what I'm told from my IT person, we can still run the audio through the courtroom speakers. And then we just have to hook up the video separately for a different projector or screen. The only problem with the way this screen is tried the prosecution? No. Being seated, please be seated. The court will recall 21 CR 2800 and 21 CR 2806. The parties and counsel are present. Dr. Buther is on the witness stand, still under oath. You may continue with your examination.
Thank you. Good afternoon, Dr. Buther.
Good afternoon.
And I just wanted to be clear, I tend to talk fast, so I will try to slow down and I will try to pause when I ask questions, and then we won't get into trouble running over each other, I hope. Okay? And you understand we just have a job to do. This is not personal. Okay. So I wanted to, my questions might be a little disjointed because I'm just kind of going through your testimony today and then going backwards. So if I lose you, just let me know. Okay? At one point, you were asked questions about research. You did a small research study, I think 13 people, about a mask. Do you remember that?
Yes.
Okay. And you were saying that you worked with a local engineer to kind of design perhaps or look into whether wearing a mask helped people when they ran who were asthmatics, right?
Yes.
Okay. You're not saying that had anything to do with this case.
No, not necessarily. No.
Okay. Because you never met Mr. McClain.
No.
Okay. You're not saying that's why he had a mask on.
No, I'm saying that's why some people wear masks.
Okay.
Anyway.
And that would be another example of an evolution, a kind of science coming forward. Fair enough?
Yes.
Okay. And you described, I believe, Mr. McClain, I think your words were at best, he was a casual runner, was the best. That's all you could conclude because you didn't know him and you didn't study him.
I didn't know him. I heard that he ran regularly, say several times per week, but I don't have a lot of details.
Fair enough. Just somebody gave that information.
Correct.
Okay. All right. Then I wanted to talk to you again about moving forward. I'm trying to go linear. At one point, you were talking about when people come to visit you, and again, they come to National Jewish, right? Most of the time?
Yes,
Sometimes you do teleconsulting, virtual consulting with people, but that's not your primary, I believe what you said.
correct.
Okay. And you said it was common for people, their doctors, to jump at the most obvious. And that was very fair and a common way to practice. But if you failed that and you're coming to see me, we really needed to delve into the situation. So is that saying, look, sometimes you have to dig deeper because you jumped at what you thought it was, but sometimes you need a specialist like you to dig deeper and try to figure out what's really going on. Is that what you were communicating?
Yes, and I wouldn't want every person who ever had a problem to come to see me. I'm too expensive and too slow.
Well, and hopefully they weren't that sick, right? And you were talking about, I think we already talked about that, so we'll skip that. You had several comments where you said, in this case, it's complex, and it takes a bunch of smart people to figure out what's going on. It's a very complex situation in response to why you reviewed other experts and factored that into what you were looking at. Is that what you were saying?
Yes.
So you had a lot of questions about ketamine. Do you remember those?
Yes.
Okay. Isn't it true, and haven't you previously testified, that ketamine is actually something you don't use very often at all?
I've used it, but I do not use it often.
Right. So when you're doing your 700 bronchoscopies, that's in a clinical setting, sometimes,
Yeah, they're clinical patients.
and maybe at the hospital, or maybe, are they ever at an outpatient?
A lot of them are outpatient, but we do them on people in the intensive care unit and inpatient as well.
Okay. And so the medications you use most commonly for your conscious sedation are Versed, is the name I know it by, midazolam. Is that what Versed is otherwise known as?
So we're trying to achieve
Yep.
sedation, and we have a number of tools
Mhm.
in our toolkit to do that. Sometimes our goal is to have the patient not deeply sedated because we need their participation.
Oh.
And we'll use conscious sedation, which is typically some combination of Versed and fentanyl.
Okay.
And that's typically at my direct order with a registered nurse who's responsible for monitoring and administering. Just as common or more common is that we will do deep sedation.
When I was going to ask you about that, that's the propofol,
That's
correct?
typically propofol, and that has an anesthesiologist who is collaborating with me, but they're guiding and directing
Sure.
it.
So is Versed, is that also midazolam? Is
Yes,
that right? Okay.
midazolam. Yes.
Midazolam. And you had made comments about how you would, depending on what you're seeing or situations, you might change the dosage or shift the procedure or delay it, depending on what you're seeing. Do you remember those lines of questions?
Yes.
Okay. And that's because you're the doctor and you can make those decisions and you can just adjust and shift what you're doing. Is that fair?
We have different protocols depending upon the clinical situation.
Do you set those protocols?
They're really not formalized, like
Oh.
it's not written on paper, but there's a standard approach to those two different buckets of conscious sedation versus deep sedation. And to some degree, it is easier for a hospital to stick with one paradigm or the other, but not mix in a number of different.
Okay. But they're not like written in a book, these are your protocols, this is what you shall do. It's
No.
more loose than that.
Correct.
And I think I just clarified that. So we'll skip that one. When you were discussing, you had mentioned that you previously had testified that you thought there were 2 ambulances, but clarified that that was 2 just rigs or apparatuses. But you also previously testified that the reason for the second ambulance is that the fire medics were not qualified to administer the medication. Do you remember that?
Yeah, this is getting outside of my expertise. I may have said that. The issue that we see in the video is they need the drug. They didn't have that.
Mhm.
It's not clear to me who's qualified or not qualified.
Okay, so you were just making an assumption based on what you saw.
Yeah,
And that's all that.
They weren't able to do that with the first rig.
Okay.
They need the second rig to do that.
Okay. But I guess what I was getting at, and I can direct you to the exact spot if you need, but when you testified, you were testifying under oath that that's what your understanding was that, let me get the exact page if we need it. So I throw that.
I don't want to object at this point. It's improper impeachment because I did not ask Dr. Uther about this. So he has to have an opportunity to either agree or disagree with the statement.
And Judge,
Response.
that's fine. I was just getting myself ready in case he needed to see it. Because I don't expect he has everything memorized. Doctor, do you remember kind of generally that question that you were asked and your response was that in general, the fire medics, it was your understanding, were not qualified or trained or certified to administer the medication?
I don't recall that being my
Okay.
testimony.
Okay. And if it was, your explanation is that you were making an assumption?
Judge, I'm going to object because that is beyond.
Sustain.
Okay. I'll ask it this way. Were you trying to give your best information under oath?
Objection, Judge, is beyond the scope.
Sustained.
Okay. When you administer things like Versed and fentanyl or propofol, you have, it sounds like it's always in a clinical or hospital setting. Is that fair to say?
Yes.
Okay. And you have nurses and/or anesthesiologists and other medical professionals right there at your command, if nothing else, or I don't know if that's.
It varies. Yeah, there are anesthesia assistants and things like that, but
Okay.
there are always other staff who are helping.
Okay. So like nurse anesthetists, or I don't know if that's, what's the term for a nurse that specializes in anesthesia?
It's complicated. There are many different types of training, but we have essentially nurse anesthetists. We also have complete MD anesthesiologists. For conscious sedation, it's usually a licensed nurse that's responsible, and I'm the one ordering the drugs. We all share in the kind of plans. We all gather together as a team to decide what the plan's going to be and share that with the patient ahead of time.
Okay. And you're kind of leading that group in that decision, that none of those participants can act without you. Is that fair to say?
No, the anesthesiologists can act somewhat independently, obviously collaboratively, but ultimately it's me that's in charge.
And the anesthesiologist is a doctor.
Yes.
Okay. When you were talking about in your practice using sedatives such as Versed and fentanyl and propofol, you said it's extremely serious for you to do trainings, and you do them how often? Annually, monthly? What was it?
So we're required every time we are, every 2 years, we have to be re-privileged at the hospital. So hospitals have to agree that you're a doctor in good standing and belong there to take care of patients so that hospitals can keep their patients safe. And as part of that, every 2 year, we have to go through a training to prove that we have both spent time studying and demonstrated competency in the safe use of sedation. And sedation meaning any number of drugs to accomplish this, and how do we monitor and keep patients safe?
Okay. So, and that's not unique to National Jewish, or I thought I heard you to say National Jewish had additional requirements, that you were part of a committee that you guys imposed additional, more stringent trainings. Is that not?
No, this is at least a state requirement. I'm not aware of any federal requirement, and was instituted something like 5 years ago to improve safety. So anyone that wants to do sedation to a patient, whether that be an emergency room physician or a GI doctor or a pulmonologist, in any setting would have to go through that training.
Okay, so that's what you were referencing when you were testifying, is that's how you follow your training.
Yeah, my point is that we are really the experts in sedating patients.
Okay.
When I say we, that is anyone who has this training, who routinely does procedures with patients. And so it is emergency room, gastroenterologists, some cardiologists, lung doctors. Pediatricians do this, where actually they use ketamine more often. And it's a broad group, and they all have different types of patients, but it's the same set of concerns and approach and training.
Okay. And you just said pediatricians actually do it more often because ketamine is used, to your knowledge. Well, I think this is actually outside of your scope, but your knowledge is that they use it regularly with pediatric patients.
I don't know if regular is the right word, but because it has this dissociative quality, it can be useful for kids.
Okay. You were talking about, and I'm shifting, you were talking about when your lungs stop, when you go into respiratory arrest, your heart will stop. Do you remember that? When your breathing stops.
Yes.
The same is also true, correct? If your heart stops, your breathing is going to stop.
If your heart stops, everything stops.
Right. So that can go one way or it can go the other way.
Yes.
In your review of Mr. McClain's records, there was never any sign of him having anemia, was there?
I don't believe so.
All right. I could have just a couple more moments and then I might be done asking you questions. So when Mr. McClain was very ill, as you put it, critically ill, before he got the ketamine, you have no clue whether or not he would have survived at that point in time without more intense intervention, do you?
No, I believe he would have survived.
You believe that prior to getting the ketamine, without anything else, he would have survived?
Most likely, yes.
So do you remember testifying differently, that he was critically ill and you couldn't say without intervention whether or not he would have survived?
I am not able to give you 100% on anything in medicine.
Sure.
So my testimony and my past statements have all been consistent that it is more likely that he would have survived. In fact, it's my testimony, I believe, that most likely he would have survived with the right intervention, but there are no guarantees. There's risk of harm, and it is in my earlier 2023 statement that had we just stopped before the ketamine, there was serious risk of bodily harm and injury, even death, but more likely he would have survived.
So when you were testifying previously, you were saying, based upon his progressive decline in mental status, that you were concerned without intervention that he may not survive.
Yes.
Okay.
This is proper impeachment because he can't see his own statement. So he has an opportunity to hear it or read it, and then he can respond.
Well, Judge, I just asked him and he agreed with it.
Well, I think for the appropriate foundation to be laid, it's the date, time, place, and given the witness an opportunity to view it to make sure the context is correct.
And I'm happy to do that but I want to rely on your memory, and I think I'm understanding correctly, is you're saying that the hypoxia, the acidosis, and what was the third one? Aspiration, would have put Mr. McClain in a critically ill situation, correct?
Yes.
And he was in that situation prior to receiving any ketamine.
Yes.
And if you had come upon him, I think your example has been at a baseball field, you would have called 911.
Yes,
Right?
he needed help.
And you thought he would need to be in the ICU, probably for a while.
Just to make sure, especially given that, this did not happen in a hospital, so we would need to make sure we had all the resources available to, if he was sicker than we thought, we would be prepared to take care of him.
And you were concerned he could have died. You don't know. It would be completely speculative to know.
We had people on a tall ladder that were a little too high up in that ladder just a few minutes ago, and they could have fallen and died.
Right.
So we're not in the business of absolutes in medicine. What I'm saying and have said is that had you stopped and got him appropriate aggressive medical care at that point, it is much more likely he would have survived. And perhaps he would have been injured or spent time in the hospital, but he would have survived.
And you also are of the mindset that sedation in the field, by that I mean pre-hospital settings, should never occur without monitorization and direct oversight. Isn't that your opinion?
Object, Judge. I think that mischaracterizes his opinion in the past, and if the defense is going to go into that, they need to be able to show him the statement.
I agree.
I'm not asking about in the past. I'm asking today, based on your testimony and based on your statements, it appears that you feel very strongly that if you're going to use sedatives in the field, by the field I mean outside of a clinic or outside of a hospital, that should only be done if there is immediate monitoring and constant watching. Is that fair to say?
So you've asked this question several different ways.
Sure.
So I'm a little concerned. I don't know which question I'm answering here. When you said direct supervision, I never said that.
I didn't say direct supervision. I said direct monitoring and observation.
So I want to be clear, you said direct supervision in the second version, but this third version of the question, you did not include that. So you need some sort of monitoring and assessment of the patient before, during, and after this. It's going to be, and it's going to look different than the hospital. This is not just my opinion. This is the standard of care in the field.
Well, you're not a pre-hospital doctor, so I'm asking your opinion. Based on what you've testified to, you can't talk to standard of care in a field you don't practice in. So I'm saying your opinion as to sedation.
I'm going to object. Now counsel is now testifying, and she interrupted Dr. Cooper, and I think he has a right to.
Sustained.
Go ahead and under that, go ahead and answer.
So what question am I answering now?
All I'm trying to ask you is it sounds like you have very strong opinions about sedation and what needs to be surrounding it. Is that fair to say?
I'm also going to object to the counsel's characterization of his opinion. It's argumentative, and I realize this is cross-examination, but it doesn't need to be argumentative at this point.
Well, that was probably the least argumentative of the questions asked, so I'll allow it.
So my passion comes because I understand the risks of this type of intervention. And when we have had patients who have had problems with sedation, it is usually because there isn't that proper assessment and monitoring and preparation for the unexpected, or in this case, the expected outcome. And so it is important in everything that we do in medicine that we are doing the right thing at the right time, because we're doing these things to people. That's very different than a lot of situations. So what I'm passionate about is you can't, again, like I testified earlier, you can't put a blindfold on in the dark on the highway and hit the gas.
Absolutely.
And so what I've testified to and I think based on my expertise made clear is that you need some sort of adequate assessment and ongoing monitoring and ability to intervene as part of how you use a drug safely and competently. It's not just about the drug. And I was passionate about including that in my opinion all along, because I was worried people are just too focused on how many milligrams somebody got, when really it's this bigger, more complete picture of how we do this safely.
And you spend a lot of time trying to correct systems and system safety within the hospital, fair?
Objection, Judge. Relevancy to this case.
Well, it's been asked and answered as well.
Is that part of what you're,
So sustained.
is that passion?
Did you
I'm not asking that, Judge.
I'll ask a different question
It
then?
is a different question. Thank you. Is part of your passion surrounding how to have the best forward-looking medicine?
Objection, Judge, relevancy to this case.
Response.
Judge, he's talking about why he's been passionate this whole time, and I can ask it a different way. That's fine.
I sustain the objection.
Have you ever written protocols for paramedics?
No.
Okay. Dr. Buther, in getting ready for your testimony, is it fair to say you've spent a long time going through all the exhibits, well, all the medical records?
Yes.
Just have been asked and answered.
Judge, I'm just winding up. I'm winding down.
All right, well, it has been asked and answered.
You have also spent a lot of time meeting with the Attorney General's office. Isn't that fair to say?
At times, yes.
And prior to coming to court yesterday, you had been paid $39,492 for your testimony and your preparation. Isn't that true?
I would need to go back and look. That high of a number likely means that we're talking cumulative going back 3.5 years, I'm guessing.
So if invoiced as of 11/22/23 to the Attorney General's office is $39,492 from David Buther, would you agree with that?
It's probably reasonable.
Okay. And you get $600 an hour when you're sitting on the stand, correct?
Correct.
So we have had about 6 hours today, 2.5 hours yesterday. So we're just shy of, this is why I'm a lawyer and not a math major, but just shy of $5,000 just for yesterday and today. Is that right?
Yes, this stuff is expensive.
If I could have just a moment.
Yes.
I don't have any further questions. Thank you, Dr. Buther.
Thank you.
All right, on behalf of Mr. Cichuniec.
Thank you, Your Honor. Good afternoon, Dr. Buther.
Good afternoon.
Being sensitive to the judge's admonishments, I have kept a scrupulous list of topics that you have already been asked about, and I'm going to try to either simply add on to those a little bit or talk about something different. Okay? One of the last areas that Ms. Bagan asked you about was, she said, you've never developed protocols for paramedics, correct?
Correct.
And are you at all familiar with the policies and procedures governing the actions of paramedics for the city of Aurora?
I have casual familiarity with how paramedics operate and policies and procedures, but not specific or to the city of Aurora.
Okay. And with specific respect to some of the footage that you viewed in connection with your testimony earlier, some of the video footage, very often you cannot see everybody who is on scene at the same time in any given video, correct?
Correct.
And are you aware of the identities of the various Aurora Fire personnel who are on scene at any given time in any of those videos?
No, not necessarily.
Okay. Are you aware or familiar with the ranks that are held by various individuals within the Aurora Fire Department?
No.
And are you aware at all of the employment structure in terms of who might be a firefighter, who might be an EMT, who might be an EMT paramedic, those various levels of authority within the Aurora Fire Department?
No, I don't have specific knowledge or awareness.
So if I brought up a still frame that had all of the AFR personnel that were on scene the night of Elijah McClain's contact, you would not be able to tell me who was a paramedic, who was an EMT, and who was simply a firefighter, correct?
Correct.
You are aware, however, that none of those levels of medical proficiency, I will call them for lack of a better descriptive term, are doctors, correct?
Correct.
None of them have your level of education, correct?
Yes.
None of them have your level of expertise in treating medical maladies.
Some of them have as much or more experience than I do in certain situations, but I agree with what you're saying.
In emergency situations, correct, right?
Sure.
It might be entirely possible that an EMT who is not a doctor has had so much experience that they actually have more experience than you do in a specific situation, correct?
Correct.
Particularly emergency situations outside of the hospital environment, right?
Correct.
Just a little more detail, and I'm sorry for jumping around, but there was some questioning about, it was your understanding that in order to administer the ketamine to Mr. McClain, paramedics needed another vehicle on scene. Do you recall that question?
Yeah.
And that was your understanding, right? There were two vehicles there that night. One of them was needed to arrive before the ketamine could be administered.
That was my understanding.
But you don't know why that was the case.
I just recall audio on these recordings saying, that other rig has the ketamine. So I don't have full understanding, no.
Okay. And if you just give me one moment. Oh, in your practice, do you run into patients that have been restrained by law enforcement?
Yes.
And are there any protocols in place that you are familiar with in your practice governing the transfer of custody from law enforcement to medical personnel?
I'm not familiar with any. I've been in that situation, but usually others are responsible for that. So I'm not familiar with the protocols.
When you say others are responsible for that, what others are responsible for what?
For safety and management. So I would be an ICU, intensive care unit doctor, where we have a patient that is restrained and there's a law enforcement officer in the room. Nursing often has a more sophisticated understanding of the rules. Sometimes we have to loosen those restraints to perform procedures, and it's usually nursing that helps me understand what I can and can't do and how I do it, is all I'm saying.
Okay, so you're not direct, and so obviously what you just said suggests that the nurse is more familiar with the safety protocols having to do with law enforcement custody than you.
Probably because they more directly interact with it.
Correct, but you rely on the nurses to kind of let you know what the field of play is with respect to patient restraint in those situations.
There's commonly a conversation with law enforcement as well.
A conversation with law enforcement that goes on in the context of you needing to have them loosen restraints and things like that.
Correct.
Okay. And that is facilitated between you and usually the nursing staff and the law enforcement presence that's there.
Correct.
And this all occurs inside of your practice area, inside of your hospital, correct?
Correct.
And you certainly don't have any training in law enforcement restraint techniques or law enforcement arrest control techniques or anything like that.
No.
Just one moment, Your Honor.
Sure.
Thank you, doctor. I appreciate your time. I know it's been a long day. I don't have any more questions for you.
Thank you.
Redirect examination.
Good afternoon again, Dr. Luther. I wanted to ask the question about the payment that you've received from the Attorney General's office.
Okay.
Does it include the fact that you've written 3 reports in this case?
Yes.
Does it include that you've given testimony, including today, 4 different times?
Yes.
And each time that you've given testimony, is it over multiple hours?
Yes.
And if I heard correctly, it's been 3.5 years that you've been involved in this case and put hours into this.
Yes.
Counsel asked you on cross-examination some of the health risk issues that Mr. McClain had as a child. Did you take into consideration that information when you determined your cause of death and when you ruled out certain things?
Yes, of course.
So in your review, when she was asking you about the fact that he had a heart murmur, did you take that in consideration?
Yes.
And did that have anything to do with why he died on August 24th, 2019?
Absolutely not.
She also indicated about his trips as a child to the emergency room or to a clinic about asthma. Did you take those medical reports into consideration when you made your determination of cause of death?
Yes, I did.
Did it have anything to do with why Elijah McClain died on August 24th, 2019?
Absolutely not.
She asked you about a time when he was a teenager when he had a collapsed lung. Did you take that into consideration when you determined your opinion concerning his cause of death?
Yes.
And did that collapsed lung that occurred when he was a teenager have anything to do with his cause of death on August 24th, 2019?
No, it was treated and resolved a long time ago.
You were asked a series of questions about what does it mean to have an enlarged heart? Do you remember those questions?
I do.
In this case, was there anything about Mr. McClain's heart that you took into consideration as far as his cause of death?
Yes.
And what did you take into consideration?
So I really wanted to make sure that there wasn't a primary heart problem. And while uncommon, heart problems can happen. But the findings in the University of Colorado records and the tests that they did were overwhelmingly supportive of a global injury to the heart from low oxygen that we commonly see after a respiratory arrest. And there were EKG electrical tracings of the heart that were abnormal in a kind of non-specific way. And this is very common when someone recovers from a respiratory arrest, that we see the heart is irritable and recovering. So everything was consistent with the heart was the innocent bystander injured by the event of the respiratory arrest. But we were going through that list. Sometimes sudden death can happen in young people because of a blood clot to the lung, and we would see that on the heart studies, that the right side of the heart was upset. But we did not see that. So it helped rule out definitively, along with the autopsy, the coroner's report really showing no significant underlying heart disease.
And are you making this opinion to a reasonable degree of medical certainty?
Yes.
You were also asked questions about the fact that Mr. McClain had certain underlying medical conditions before ketamine.
Yes.
And I wanted to ask you, to a reasonable degree of medical certainty, is that the reason why he died?
No.
Why not?
They were aggravating factors. They were issues that made him sick, but they were all treatable and reversible.
You were asked questions about whether or not he would have survived or could he have died because of those acidosis, aspiration, and hypoxia. What is your opinion on that?
To a reasonable degree of medical certainty, he would have survived with some fairly straightforward medical treatment of those issues.
So he had never been given ketamine by the paramedics. What would his course of treatment have been in the hospital?
So he likely would have needed some support for his breathing, oxygen, maybe even some additional support, antibiotics to treat possible infection that could evolve from this. Might need a lot of help from respiratory therapists to help him clear that material out of his lungs, IV fluids, monitoring, and a thorough assessment you can only do in a hospital, making sure that kidneys and other organ systems were okay.
You were talked to about your opinion regarding sedatives in the field. It's not just sedatives in the field, is it, Dr. Bruther?
I'm sorry, what do you mean by that?
Well, is it the degree of the sedative in the field that you have talked about?
Sure, it is both the action of initiating sedation, but also the choice of medicines and how much sedation, but not so much a specific drug or a dose, but what is our goal of sedation? What are we trying to achieve? Are we trying to just reduce anxiety? Are we trying to go to conscious sedation? Are we trying to go to deep sedation? That's how we think of sedation.
Should you do deep sedation in the field?
Again, my experience is in the hospital, but you need to make sure if
outside the scope of his expertise, he's not an expert in pre-hospital care, cannot testify to what occurs in the field and what might be appropriate.
Response.
I agree, Judge. That's why I asked about deep sedation, and he talked about in the hospital.
All right, well,
A question.
not going to, yes, it was.
Okay.
So it's sustained.
I'll withdraw it. You were asked questions about people in custody, and have you worked with law enforcement in order to do sedation or procedure?
yes,
Can you do monitoring assessment if a person is in custody?
yes,
Can you still do the procedure when a person's in custody?
yes.
Thank you. I have no further questions.
Thank you.
May the witness be excused?
Sir.
Right, you may step down. Next witness for the people.
Your Honor, the people would call Daniel De Jesus.
Please be seated. Once you're comfortable in the chair, I'm going to ask that you speak a little bit loudly or close to the microphone. And if you could tell us your first and last name, and please spell your last name for my court reporter.
Daniel De Jesus, Dejesus.
Your witness.
Thank you, Your Honor. Mr. De Jesus, what is it that you do for work?
I'm a firefighter for the Aurora Fire Department.
And how long have you been with Aurora Fire?
8 years now.
What is your current role with Aurora Fire?
I'm a fire medic.
And in 2019, what was your title?
I was a basic EMT firefighter.
So in 2019, at that point, you had been with Aurora Fire for about 3 years. Is that correct?
Yes, ma'am.
Prior to being a firefighter with Aurora Fire, did you have a career prior to that?
Yes, ma'am. I served in the Navy for 5 years.
And was there any medical training for you to have that role?
Yes, ma'am.
So I'd like to talk a little bit about the training that you received in order to have your role as a fire EMT. Okay. So what sort of training was involved in order to become a firefighter with Aurora Fire?
Are we asking about my role as a firefighter or my EMT school?
Let's start with firefighter and then the EMT school because it sounds like that's an additional piece.
Firefighter, I went through, I believe it was a 16-week fire academy with Aurora Fire that focused on firefighter certifications, hazmat certifications, and testing to become accredited in both.
Okay. And I might ask you just to speak a little bit more to the mic. You have a very quiet voice.
Been told, yeah.
It's okay. And your training in order to become a firefighter, is that hands-on or is it in a classroom?
It's a mixture of both. You do a lot of hands-on and testing in the classroom.
Okay. And then in order to become an EMT basic, I think I heard you say that that was some additional training that you took.
Yes, ma'am. That was taken before I was hired with a 6-month course through a community college.
And what are EMTs within Aurora Fire responsible for?
It's an emergency medical technician. They do basic life-saving maneuvers. We can do vital signs, basic CPR functions, and assist the paramedic in any way that they see fit.
Okay, and are paramedics within Aurora Fire sometimes referred to as fire medics?
Yes, ma'am.
And what is the more common term, just so I use the right one?
Medics.
Medics?
Mhm.
Okay. So if I say medic, I will be referring to a fire medic or a paramedic medic. And then if I'm referring to the more basic, the EMT basic that you were referring to, would it be appropriate to call that EMT?
Yes, ma'am.
Okay. So I'd like to now turn to your assignment within Aurora Fire, and again, focusing on 2019. Are firefighters within Aurora assigned to a particular station or location?
Yes, ma'am.
And were you assigned to a specific station?
Yes, I believe I was assigned to Station 2 at that time.
Where is Station 2 located?
12600 East Hoffman Boulevard.
And is Station 2 what is known as a double company?
Yes, ma'am.
And what does that mean?
We have an engine and a ladder truck in there as opposed to just an engine.
Okay, and what is the difference between the two?
Engine has the water, a ladder truck has extrication tools and the big aerial ladder for roof operations and rescues and things like that.
And is an ambulance one of the vehicles that you have within your company?
No,
So how do you get an ambulance to the scene?
they're dispatched with us to medical scenes through their own separate dispatch.
And is that how they learn that they need to join you on a scene?
Yes,
And when you're both dispatched to a scene, who has medical control over that scene?
the fire department does.
And are you always dispatched at the same time?
I'm unaware if the dispatch times are equal.
When a call comes in, are both units dispatched at about the same time?
I believe so. Again, they have their own dispatch, so I don't know if there's a delay in that, but we are dispatched together, yes.
Okay. And when you're within a station, how are you alerted that you need to respond to a call?
There are certain tones that come out over the overhead speakers in our station.
And do certain tones mean certain things?
We have just one tone for the engine and one tone for the ladder, and then there are tones for chiefs at chief stations.
Okay. And is Station 2 a chief station?
No, ma'am.
Okay, so it would just be the two tones.
Yes, ma'am.
Okay. And how do you know, as a firefighter or a fire EMT, how do you know that a tone is for you?
Like I said, there are separate tones for the engine. I am on the engine, so when the engine tones goes off, I know that's my call.
Okay. And are you permanently assigned a tone, or does it vary?
It's been the same since I've got on.
Okay. So now I would like to turn your attention to August 24th of 2019. And what I'm going to be doing is asking you some questions and then kind of throughout the testimony using some body worn camera footage to help assist you in your responses, okay?
Okay.
So were you on duty August 24th of 2019?
Yes, ma'am.
Were you assigned to Station 2 at that time?
Yes, ma'am.
And engine company, as we talked about?
Yes, ma'am.
Okay. And when you're assigned to engine company, do you have a particular role within that company?
Yes, ma'am.
And what was your role?
My role was the firefighter there. That particular night, though, I was at an acting position as the engineer.
And what does that mean?
I was the driver.
Is the acting engineer responsible for anything else?
Pumping operations on a fire, driving to the scene. On medical scenes, I would be scribing with a laptop that we had at the time.
Okay, so for a medical scene, you would be responsible for, I think you said scribing.
Yes.
What does that mean?
I have I think it was a laptop at the time. Now we have an iPad. If anything said that's pertinent or vital signs or name, date of birth, anything like that said, I would scribe it down. And then for the PCR later, we would have all our information we needed from the scene.
Okay, and PCR, does that mean patient care report?
It does.
Okay, and are some of the fields within a patient care report auto-populated?
I believe they are, yes.
So on the night of August 24th of 2019, did you ultimately get a tone that night?
We did.
And it was an engine tone?
Yes, ma'am.
How did you know whether it was for a fire or for a medical assist?
Sometime after the tone, dispatcher's voice will come over and dictate whether it's for a medical or a fire.
And who else was assigned to the engine that night?
At the time, it was Lieutenant Cichuniec, fire medic Jeremy Cooper, myself, and then the backseat EMT was Austin Bradley.
What does it mean to be a lieutenant on an engine?
You're the officer. You're ultimately in charge of everything on the engine. It's a promoted position. It's kind of a position of leadership among the rig.
And do lieutenants have any specialized training?
They take a promotional exam and they do things that I guess we don't, but I don't think they have specialized training in fire or things of that nature, no.
Okay, it's more of the managerial leader type role.
Yeah.
Okay. And was Lieutenant Cichuniec, was he a paramedic?
Yes.
Okay, so a fire medic that we were talking about earlier?
Yes, but he would go under the title lieutenant at the time.
Lieutenant, okay. But he was trained as a fire medic.
Yes, ma'am.
And then you also mentioned fire medic Jeremy Cooper. What was his role on the engine that night?
He was the paramedic on the rig.
And what does that mean to be the paramedic on the rig?
Every rig has a paramedic assigned to it, and that was his role for the day, as a paramedic.
Does that give them any special control or responsibility over a scene when you're dispatched?
They typically run the medical calls and are in charge of the medical side of it.
And what does that mean?
If we go to a medical call and me as the EMT wants to do something, I would have to run it by my medic to make sure that's okay with him. So he is ultimately in charge of me, especially being the higher trained medical personnel.
And then you mentioned a fourth person, fire EMT, Austin Bradley. So at that time in August of 2019, did he have the same level of training as you did at that time?
Yes, ma'am.
And what was his role going to be on the rig?
He was the EMT on the rig, so assisting the medic on medical calls and a backseat firefighter pulling hose on fires.
So with these different roles, when you get into the engine, do you have specific seats that you need to sit in?
Yes, ma'am.
So you're the driver, so I'm assuming you're in the driver's seat.
Correct.
Who's in the front passenger seat with you?
It'd be the lieutenant.
Okay, and what or does he have any particular responsibilities sitting front passenger seat?
He maps us into wherever we need to go, gets the notes, talks to dispatch through the radio, dictates kind of how we approach the scene, how we get there, and what our approach is.
And when you're saying how you're approached, do you mean with the engine or throughout the call?
More so with the engine, but it can't be throughout the call, yes.
And you mentioned that he's responsible for speaking over the radio. Does that continue throughout the call, or is that only when you're on the engine?
It continues throughout the call.
And where was paramedic Cooper sitting?
He would sit directly behind me,
And then EMT Basic Bradley?
directly behind the lieutenant.
So I just have a couple of questions about what happens at the station before your engine leaves. When you hear the tone, do you have any specific details about what type of call you're going out to, other than it's fire or medical assist?
Upon the tone originally coming, occasionally there's some notes. It could be a medical assist, a lift assist, or it could be a fire alarm, first alarm fire. But the real notes come later in the call.
So if it's a medical assist, how do you know what tools or equipment you're going to need on the call?
You don't know yet.
So how do you prepare the engine if you don't know what you're walking into?
Well, we bring everything on every call, so there's no need to prepare what to bring. If anything else is needed, like extrication equipment on a car accident, we would get those notes as we come in.
Okay. And so does that mean the engine is kind of pre-stocked with everything that you're going to need on your call?
Yes, ma'am.
And is it someone's responsibility to make sure after you've returned to the station after a call that it's restocked and ready to go for the next one?
If we use anything on the call before we go back in service, we will restock it as a crew.
And in order to make sure that you have everything that you need, is there like a checklist that you work off of?
We do have an inventory list, yes, but we're all aware of what's in our kits, and when something's missing, we check them every day in the morning.
And is it important, and you said kits, how many kits do you have?
Well, I call them kits. We have an orange kit, a black kit, a blue airway kit, a pediatric yellow kit, and a cardiac monitor.
Okay, and in 2019, is that the same list of kits?
Yes, minus the pediatric kit that was just lumped together in our orange kit at the time.
Okay, and we kind of blew through that list pretty quickly, so I'm going to back up a little bit. So I heard an orange trauma kit,
That's correct.
a black kit,
Yes, it's an airway kit.
black airway kit, and then I heard a blue kit,
Yeah, it's more of a bag. It's an oxygen.
and then was it a cardiac kit or a cardiac?
We have a cardiac monitor.
Now, I'd like to talk about each of those kits, bags, and monitors individually.
Mhm.
What is in the orange trauma kit?
There's quite a bit in there. We have everything related to trauma, a whole trauma kit, anything to stop bleeding, from combat gauze to tourniquets to sterile gauze, our patches for bullet wounds. We have splints and splinting accessories for broken bones, immobilizing, things like that. We have a drill for drilling into bone for access in case we can't get an IV. We have saline in there and IV kits, glucose in case we need to give a diabetic patient, things like that. And then we have certain drugs in there.
Do you also have things like a blood pressure cuff?
Yeah, we have basic vital sign equipment.
And what would those basic vital sign equipments?
Blood pressure cuff for different sizes. We have stethoscopes in there, a blood glucose meter.
And then the next one I believe you mentioned was the black case containing airway support equipment.
Yes.
What is in the black case?
That's our airway kit. We have our intubation tubes and our air tracks. We have our bag valve masks. We have chest decompression needles. We have our suction in there. And our eye gels, our backup airways, anything involving airway is in there.
Okay. And do you have like CPAP?
We do CPAP in there. You obviously know better than me.
All right. And then the third one you mentioned was the blue oxygen bag. What's in the blue oxygen bag?
It has a bottle of oxygen that we can use for oxygen tubing. We have our nasal cannulas, our non-rebreather masks. We have medication for asthma, things like that, for nebulizers in there.
Okay. And then the last one you mentioned was your cardiac monitor. So what does that look like?
It's kind of a boxy machine with two saddlebags on the side. Has our EKG limbs that we can use for that. Has a blood pressure cuff, a pulse oximeter. We carry our aspirin and nitro in there, some drugs. We carry patches in there, a blood glucose monitor, different sizes of blood pressure cuffs, and then cardiac pacing monitors for CPR, CPR puck.
And these 4 kits, well, I'll talk about the first 2 cases. So the orange trauma case and the black case, how big are those?
They're decently sized Pelican cases. They probably weigh 20, 25 pounds.
And you say decent size. Just in case someone doesn't know what a Pelican case is.
Probably twice the size of that orange binder there.
Also the white binder with the orange paper on top.
Yes, it looks orange to me from here, sorry.
And the black case is around the same size?
They're both the same size.
Okay. And what about the O2 bag? How big is that?
That's probably about 2 feet long.
And the cardiac monitor?
It's probably maybe the size of these laptops here. And then the saddlebags on the side add some.
Okay. So for the cardiac monitor, you said it has saddlebags. So is there kind of a screen on the outside of the bag that you can see while you're on scene?
Yes.
Okay. But for all 4 of these things, are they easily transported by hand?
Yes, between the crew.
Okay. So you're at the firehouse on August 24th, or you're at Station 2, excuse me. You hear the tone for engine company. What happens next?
We all go to the rig, and then the lieutenant will tell me where to go as a driver, and I'll go there.
How soon after pulling out do you know what this call is going to be about?
For this particular one, I don't remember the exact time, but every call kind of varies how long the dispatcher will take to relay the notes to you.
And relaying the notes, can that come over the radio?
Yes, that's over the radio.
And can it also come on the laptop or the tablet that's being carried?
Yes, not going carried in the MDC, which is a computer that the lieutenant has access to there, which has the directions and whatnot, also has notes of the call.
Okay. And so is that separate from what you mentioned the scribe would carry around the scene?
Yes, ma'am.
Okay. Is it kind of hard stuck into?
It's in a fixed place, yeah.
That was a better fix as opposed to hard stuck. So on August 24th of 2019, where were you dispatched to?
Just north of the intersection of Colfax and Billings.
As you're en route, are your lights and sirens going?
Yes, ma'am.
So now I'd like to talk about your arrival at the scene. Where did you park? And actually, if I could please have what has previously been admitted as Exhibit 301 displayed for the witness and the jury. This is the map. And if we could focus in on just the map portion of this exhibit. Okay, so looking at this map, are you able to kind of orient yourself as to what we're talking about?
Yes, ma'am.
Okay. So how did you enter this scene? From which direction?
From the south.
South? Okay. Is there a laser pointer up there for you to use?
It's a laser pointer. Oh. Oh, there we go.
There we go.
You see that?
Okay, so if you can show the jury kind of what direction you entered from.
Entered from the street. We entered north going this way, south of the location.
Okay. And had APD actually asked you to enter from the west?
I don't remember if APD got on the radio and asked us anything there.
Okay, if I could show just for the witness exhibit 281, which has already been admitted. If you can look at the incident narrative and see if that helps refresh your recollection as to which direction you were asked to enter the scene from.
Yes, it says here they asked us to enter off Montview.
Okay. And why did you, if you wouldn't mind putting the map back up. So why did you enter from Montview, which is north, as opposed to entering, or why didn't you enter from Montview?
I'm not sure.
Had you already started driving that way and Lieutenant Cichuniec instructed you to just keep driving the direction you were already going?
I'm really unsure. It's also possible we didn't get the notes until we were too close, but I don't recall.
Okay, so what does it mean when a note says PE2 had already committed?
That means we're already too far into the scene to approach from a certain direction.
Okay. And we can take that down. Thank you so much. What time did you arrive?
I don't know, ma'am.
If we could please display for the jury and the witness exhibit 281, which has already been admitted. Do you see an arrival time?
Yes, first unit arrived 22:50, 4 seconds.
Okay. And we can take that down. Thank you. What did you see when you first arrived on scene? And I'm talking about when you're still in your engine and you're parking.
I saw a lot of cop cars pretty much shutting down the street, north and south Billings.
Was the ambulance on scene when you arrived?
No, ma'am.
And at that point, were you expecting one to arrive eventually?
Yes.
And that's because both AFR and Falk are dispatched at around the same time?
Yes.
Once parked, what did you do?
I reached back and I grabbed my laptop at the time and then get out of the rig and start walking to the scene.
And did anyone grab any of those kits we were just talking about?
Yes, the crew grabbed the kits as we were walking up.
And at that point, did you have any very clear information about what sort of treatment you were going to need to provide, or was that still unknown?
No, I don't remember any clear treatment.
Okay, so what kits were grabbed?
I believe we grabbed all of the kits.
Okay, so all 4 cases?
Yes.
And would it be a problem if only one case was grabbed?
Would it be a problem as far as?
Well, why is it that you would grab all 4 cases before going to a scene?
Especially not knowing what you're going into. Me as the medic, I grabbed all 4 kits. We weren't sure what we were headed into, I believe.
Okay, and is that so that you have the tools that you're going to need available close to you once you get there and know what you need to do?
Yes.
Okay. So you mentioned that the ambulance wasn't there yet. If they had arrived first, would they be expected to bring the kits to the patient?
Yes.
And what would you do as the arriving fire engine to make sure that the kits were there beside the patient?
If they're there first, we could radio them and ask them if they have all their kits or if they're in need of anything.
So if they needed anything additional, that you could bring it to the scene as well?
Yes.
Okay. And I apologize, I keep saying to the scene and to the patient. I should just be saying to the patient. Okay. And vice versa, if you're on scene first, could Falk radio to you and say, hey, do you need anything additional for this patient?
Yes, they could.
Okay. So as you all get out of the engine, you have your tablet to do the scribing? Okay. And did you run or walk to the patient?
We walked.
Okay. And what were you seeing as you're walking up towards the patient?
There was a lot of police activity, a lot of police cars. We were about a block away, so we couldn't get closer there. And then a big police presence, I remember walking up to.
So how did you know that it was safe for you to walk up to the patient?
I guess you never know if anything's truly safe, but police did call us in as opposed to staging us.
Okay, and when you say call you in, that means call you in so you can get to the patient and do what you need to do?
Yes.
And so do you get called in when the scene is safe and not when they're particularly done doing whatever it is they need to do with their suspect?
I'm not sure how they, what their protocol is for when they call us in, to be fair.
Okay. But if they ask you to stage elsewhere, is it because it's not safe for you to come in?
Typically, yeah.
Okay, and what would be an example of that?
If they had someone at gunpoint or they were getting shot at, obviously they don't want anyone else in the line of fire. So we've been staged on calls like that.
Okay. So barring that sort of scenario, are you able to come in and care for the patient?
Yes.
Can I help you?
Your Honor, permission to use the bathroom for emergency use?
Yes, why don't we take a quick break and,
Wet bullets, I'm sorry.
well, that's okay. Yeah, and, you know, I'll just have my staff take the jurors back into the back. We've got 2 jury rooms back there in case anybody else needs to use the restroom. No former express any opinions, discuss the case, do no independent research, and avoid press coverage. right, can we get started? Right, jurors will be entering.
Thank you, Your Honor.
Sure. All right, our jurors are back. And the witnesses on the witness stand still under oath. Just let counsel know, I'm not sure how long this is going to take, but I'd like to take a break at about 3:30-ish.
Okay, I'll find a good breaking point around that time.
All right, fair enough. All right, you may continue with your examination.
Thank you, Your Honor. So, Mr. De Jesus, before we kind of get back into the questions here today, do you know both Jeremy Cooper and Peter Cichuniec?
Yes, ma'am.
And at some point, were they kind of your superiors within the engine company?
Yes, ma'am.
And are you testifying here today pursuant to a subpoena?
Yes, ma'am.
Thank you. Okay, so what I would like to do now is kind of take us through the scene. I'm going to ask you some questions as we go through and then use some video to assist with your testimony. And my plan is to do this as chronologically as possible, okay? So if we could please pull up Exhibit 107 and begin the clip at 22:52:25.
So he was put into a carotid. He did lose consciousness. He's throwing up right now, and he's obviously on something. So, yeah, we're gonna have to have him transported. Yes, what's that?
And if we could now play Exhibit 111, 22:52:59. And this is going to be the same kind of time frame, but from a different body worn camera. And then I have some questions for you.
In a
So
mask?
he was put into a carotid. He did lose consciousness. He's we're gonna have to have him transported. I think we're okay for here. I appreciate it.
Thank you so much. Okay, so was that you in the video that we saw walking up to the scene?
Yes, ma'am.
And it looks like you received a summary. Is that pretty common when you first arrived to a scene to engage with APD?
Yes, ma'am.
And what did you learn in that summary?
Just from watching this video, it sounded like the patient was put in a carotid hold and had vomited.
And had the patient lost consciousness?
I don't believe I heard that.
Okay, and then possibly on something?
Yeah, that's what he said.
Okay, if we could replay that, the first one, because I think the audio in the first one was a little more clear. That is Exhibit 107.
So he was put into a carotid. He did lose consciousness. He's throwing up right now, and he's obviously on something. So, yeah, we're gonna have to have him transported. Yes, what's that?
And so as the scribe, what was the importance of those four things that you learned?
As a scribe, I didn't write any of that down. That was more of a crew conversation, I guess, if we could all figure that out.
And what do you mean by a crew conversation?
That's just something the crew would want to know, not that I would write down.
Okay. And by the crew, you mean defendants Cooper and Cichuniec and EMT Basic Bradley?
Yes, the four of us.
Okay. And did everyone in your crew get that information?
I'm not sure.
Since you were given that information, would it be part of your role to make sure that the rest of your crew got the same details about the scene you're dealing with as
Yes.
everybody else? Okay. So now I would like to play Exhibit 107 at 22:52:37. And this pretty much kind of picks up where we just left off. We're kind of walking through your first arrival on the scene. 107. And for the record, this is Sergeant Leonard's body-worn camera.
Give it one more try. Oh, there we go.
I think we're okay for here. I appreciate it. Thanks. And he had a mask on. I know that, yeah.
And then he was like throwing his hands up, but he said he didn't feel threatened or anything. He just thought it was weird.
Okay.
I've still got him on the phone if you want to ask him anything.
No, I just wanted to get the front end. The best he could explain what was going on and why we got called.
Okay.
And if there was anything criminal, but doesn't look like there was.
Sound like it?
Okay.
I'll get some more details.
Okay, I appreciate it.
Okay, and actually, if I could have you back up to 22:53:06 and just keep that still up there. I have a specific question rather than us having to watch the whole clip. Okay, perfect. So that orange kind of box looking thing that we see there by the back of the patrol vehicle, what is that?
That's our orange kit.
Okay, so that's the orange trauma kit?
Yes, ma'am.
Okay. And if we could now please play Exhibit 111. This is Officer Alicia Ward's body-worn camera. And while we're watching this clip, I would like you to pay attention just to kind of where the medics are positioning themselves around Elijah McClain. This was Exhibit 111, Officer Ward 2. 22:53:15 through 22:53:41. Thank you.
So he was just walking around. He said he didn't threaten him or anything. He was wearing a mask.
I know that, yeah.
And then he was like throwing his hands up, but he said he didn't feel threatened or anything. He just thought it was weird.
Okay.
I've still got him on the phone if you want to ask him anything else.
No, I
That was
just
about
wanted to
it.
get the front end. The best he could explain what was going on and why we got called.
Okay.
And if there was anything criminal, it doesn't look like there was.
It doesn't sound like it.
Okay.
I'll get some more details from
Okay,
him.
appreciate it.
Yeah.
Okay, and during that clip, did you see yourself holding something in your hand?
I did, yes.
And what was that?
That's our computer that I use to scribe on.
Okay. And when medics are positioning themselves around the patient that you're there to treat, how do you decide who's standing where?
There's no real protocol for how you approach a scene and where you stand.
Okay, and so how is everybody positioned around Elijah McClain?
From that video, it looks like I was to the right of the patient. It looks like Medic Cooper was positioning himself around a police officer to get a better view of him from a different angle. And I couldn't see the others if you wanted to replay it.
Okay, we'll have a couple of other videos that'll
Okay.
show a little bit better for you. So this next clip that I would like to show, which is Officer or Sergeant Leonard's body-worn camera, Exhibit 107, 22:53:13 through 27, 22:53:27. And this is when a second kind of summary of what you're working with is being given. And I'd like you to pay attention to kind of what that summary is and what that means.
He speaks English. Yeah, he's, you want to answer my questions?
Definitely not second.
But we put him out with a karate twice.
Okay.
at least once successfully. So.
Thank you so much. So did you hear Sergeant Leonard giving a summary to the medics?
Yes.
And what was important out of that summary for you as someone who needs to treat your patient?
It sounded like he put him in a carotid hold twice, at least once successfully. That's what I heard.
Okay. And can you please replay that same clip, but stop it at 22:53:23? So just 4 seconds prior to this. And after this is played, I'm going to ask you to help identify kind of who's who in the scene. Thank you.
He speaks English. Yeah, he's, you want to answer my questions?
Definitely not.
But we put him out,
So with your laser pointer, who is standing kind of looking off to the side?
This person here?
Yes.
That's Fireman Cooper.
Okay, and then who's standing there in the baseball cap?
That's Austin Bradley.
Okay, and who is in the sunglasses?
I think those are prescription safety glasses, but that is Lieutenant at the time, Cichuniec.
Okay. And where are you in this scene?
I don't know.
Okay, are you kind of back behind where Sergeant Leonard is standing?
Objection, Your
I don't
Honor.
know.
Calls for speculation. He said he didn't know.
Sustain.
We'll find another clip. Thank you.
Thank you.
If we could now show Exhibit 105. This is Officer Green's body-worn camera, starting at 22:55:22, going through 22:55:45.
I think we're okay from here. I appreciate it.
Watch your step, dude. You're
Yeah.
right as puke.
It's a little bit.
Yeah. And then like
I did not.
Passed out.
Okay.
Don't do it, dude.
Relax, bro.
Chill out.
it doesn't sound.
No.
Okay, and during that clip, did you see who left the orange bag behind the patrol vehicle?
During that clip, no.
Okay, if we could replay that clip, maybe even just back it up 20 seconds from where we currently are.
It's a little bit.
Yeah. And then like
I did not.
Passed out.
Okay.
Don't do it, dude.
Relax, bro.
Chill out.
it doesn't sound.
No.
Did that help you identify who left the kit by the back of the vehicle?
It did. That's Austin Bradley.
Okay, and did you see anybody else leave any other kits in that area?
Not in that area, no.
Okay. If we could now play Exhibit 107. This is Sergeant Leonard's BWC 22:53:26 through 53:50.
Wait, so stop messing around, man.
We'll just leave him.
You've already been told several times to stop.
I can't fix myself. Ow. Just leave him there until the end gets here and then we'll just put him down.
Hey, I know you're busy, but I,
Mr. De Jesus, what could you see of the patient at that time?
I honestly couldn't see the patient
Um,
from this video.
So not just from the video, but from your recollection of August 24th of 2019, what were you able to see of the patient? You've walked up to the scene, you're standing with the rest of your crew. What could you see of the patient?
Well, I apologize. My memory's a little hazy as it's been a few years. However, I do remember being able to see the patient's face, and then he had a coat and long pants on, so I couldn't see other skin other than that.
Was he handcuffed?
I believe he was, yes.
Okay. And was he being held down by the time of your arrival?
Yes, ma'am.
And was that Mr. Cooper speaking to the officer?
Yes, ma'am.
And we heard him asking some questions, specifically if your patient speaks English. Did you hear any other questions asked of Mr. McClain?
Sounded like he asked if he said anything.
Okay. Did you learn anything medically significant or important for you to describe based on what was communicated kind of right at the very beginning of the call?
No, I didn't.
Do you recall if anyone ever asked Mr. McClain how you're doing?
No, I don't recall that.
Did anyone ever ask him what's going on?
I wasn't there for the whole scene, but I don't recall that. No.
Did any of your crew ask if he was taking any medications?
To Mr. McClain? No.
Correct.
No.
Did anyone on the crew ask how could he be helped?
No, ma'am.
Did anyone on the crew ask him what his name was?
Not that I heard, no.
So I'd like to show the same time frame, but from an alternate angle. This would be Officer Green's camera, Exhibit 105, from 22:55:45 to 22:56:31. And during this clip, if you could please focus on what was going to be the plan for Elijah's care.
Yeah, when we tried to stop him, dude.
Come on. So does he say anything, speak English or anything like that?
He speaks English,
Yeah, he's.
but he's definitely not something. He's not having.
At least once successfully. Right. Okay, stop messing around, man.
Chill out.
Well, we'll just leave him.
You've already been told several times to stop.
I can't sense myself. Ow! Just leave him there until the ambulance gets here, and then we'll just put him down to the gurney.
Yeah, I know you're.
Have the lights. So during that clip, actually, did we kind of see you when the camera panned around standing near Elijah's feet?
Mhm.
Okay. What was your understanding of the plan for providing care and treating Elijah McClain?
From there, I can see Medic Cooper kind of, he repeated 2 times that we could just leave him there after what looks like, I can't see the patient, but it looks like the police are doing something to him there. It looks like he's trying to get them to leave him there, which was the treatment at that point.
And what do you mean by just leave him there? Like,
It appears he said that twice after they had done some sort of big movement of him. So to me, it looks like he was trying to say, let's not do that. Let's leave him here.
okay, did he say, let's not do that?
No, that's just to me. It's done like that.
At this time, did Defendant Cooper attempt to take a pulse?
No, I don't believe there was any option to take a pulse at that point.
Did he ask either you or EMT Basic Bradley to go back to the engine to get more equipment?
No, I do believe from my recollection, and I can't see in the video, but I believe we had our kits, just not by that orange kit that we can see there.
Did you see anyone else carrying anything to the scene?
Not from my recollection, off my memory, but I didn't see it in the video either. But it's not uncommon to place them in separate areas.
Did he ask you to open the orange trauma kit and get anything out to help?
No.
You've been told that Elijah had been vomiting. Did anyone go and get anything to help suction?
No.
Was anything done to check his airway?
No, nothing was done to check his airway.
Okay. So at this point, has there been any sort of verbal assessment with Elijah McClain speaking back and forth?
No, there's been visual assessments.
And is that all that's been done up until this point?
Yes.
So with a visual assessment, is lighting helpful in doing that?
It can be, yes.
It can help estimate a person's body weight.
It could probably help, yes.
And could it help you view how a patient's doing?
Yes. Yeah.
Would it provide a better visual for your patient?
Better lighting, you're asking?
Correct.
It could, yeah.
Did Defendant Cooper shine a light on the patient or on Elijah McClain to assist with his visual assessment?
I was shining a light on the patient as well as a couple other people on scene. I'm not sure if he did himself, though, which is typical for how we do things.
Were you also conducting this visual assessment with street lamps and kind of the strobe lighting of all of the emergency and police vehicles?
They were present there, yeah.
So in this next clip, we'll be able to hear Officer Leonard giving an update to dispatch. But what I would like for us to focus on is what Elijah is saying. And I will ultimately show this from 3 different angles, but I do have individual questions for each of these clips. So the first clip is from Officer Green's camera, Exhibit 105, from 22:56:31 to 22:57:24.
Yeah, I know you're busy, but I need to let you know that, we had a suspicious call over here on. Bill, I've got a mask on his face, acting kind of weird, nothing really criminal. My officers go to make contact with him. He starts acting crazy. They go to head of him, he attacked them. Rosenblatt, he ended up trying to put a carotid on.
I'm sorry, that was. Oh, we lost the, sorry. I was watching my screen and it was fine.
Trying to put a carotid on the guy. And actually.
Well, stop fighting us.
I think they put the carotid on him, they put him out, they were able to get him under handcuffs. We're still struggling with him. I have fire on scene. And that's where we're at. I just want to let you know, yeah, we did actually apply the carotid tonight, so.
Bless you. Thanks.
And the other one, I don't. Oh, you got him? Oh, I didn't know that. Okay, I knew you were busy. Just one other thing we did.
Is this his?
Yeah, that's all his. That's what he was wearing.
It was used, okay. It was very minor.
So the ambulance gets here, we're gonna go.
So during that clip, what was Elijah's body position?
I couldn't see Elijah. I could see the police, but kind of stopped at their arms, it appears.
When you were on the scene on August 24th of 2019, what position was Elijah McClain in?
I believe they have him in a few different positions, but mostly on his left side, I believe.
When the camera kind of panned over Elijah McClain on the ground there, did you see a light being shone on him?
I don't remember. If you could play that back again.
If we could go back to 22:57:10, and then I think from there forward, we'll be able to see.
Oh, you got him? Oh, I didn't know that. Okay, I knew you were busy. And just one other thing we did.
Is this his?
Yeah, that's all his. That's what he was wearing.
It was used, okay. It was very minor.
When the ambulance gets here, we're gonna go.
So I think we saw a flashlight pan on something else on the ground, but did you see a light on the patient, Elijah McClain?
Not in that scene, no.
And if we could now pull up Exhibit 104, which is Officer Rosenblatt's body-worn camera, 2254-17 through 2254-59.
Just leave them there until the ambulance gets here, then we'll just bring them down to the room.
Yeah, I know you're busy, but I just want to let you know that.
Stop.
We had a suspicious call over here on
Dude,
building.
chill out.
Had a mask on. It's exactly, acting kind of weird. Nothing really criminal. My officers go to make contact with him. He starts acting crazy. They attack them. I'm so glad he ended up trying to put a carotid on the guy. And actually.
Well, stop fighting us.
They put him out. They were able to get him out of handcuffs. We're still struggling with the fire on scene. And that's where we're at. I just want to let you know, yeah, we did.
So during that clip, what position was Elijah McClain's body in?
Looks like between his left side and his chest and stomach.
Would you call that the prone position?
Yeah, for a second while looks like he was readjusting there.
And we heard Elijah McClain ask for help. What steps, if any, did the team do to see what Elijah might need at that point?
You're talking about our team, ma'am?
Correct.
Well, it looks like Officer Bradley leaned down. That's obviously a visual representation of looking at his airway, get really close to his face. It does look like he's being under some like pain compliance, which would explain a cry for help. I'm sure that hurts very badly. And that's about it.
Did Defendant Cichuniec ask you or Bradley to go collect any of the kits to see what might be needed?
Oh, he didn't ask me, no.
After Elijah said, "Please help me," did you hear him speak that night to you or anyone else after that?
I don't have a recollection if I did or did not.
Okay. If we could please play the next clip, which is Officer Green's body-worn camera, Exhibit 105, from 2257-24 through 2257-58. And in this particular clip, I would like you to, or like us to pay attention to the next steps in treatment for Elijah.
Okay.
Sorry, what exhibit?
105.
Thank you.
Yep.
So when the ambulance gets here, we're gonna go ahead and give them.
All the cops are okay.
Perfect.
I appreciate it.
I
Thanks.
don't know what that would be.
Whatever he's
Okay,
on,
all right. Bye.
he has incredible strength.
Yeah.
And
I
I had him in a bar hammer behind his back, and his arm was above his head, and he was still fighting.
Oh.
Anybody that can relieve me for a second?
Yeah.
Spitz! I'll be somebody. You want to just get on for a second? You might plan.
I kick his legs up and just.
Yeah, well, yeah, if he keeps on.
And were you able to hear what the decision was?
I really hear some of it. It's hard to hear because the camera's right under the police officer's voice. So I heard mostly him, but I did hear some of what Cooper said, but there was a lot that I can see his mouth moving I didn't see.
And what was your understanding as to what the next step in treating Elijah McClain would be?
When the ambulance gets here, we're going to drop ketamine.
And at this point, had you been on scene for about 5 minutes or so?
Sounds right, yeah.
Okay. Had anyone at this point taken Elijah's pulse?
No, ma'am, I don't believe there was a chance to take his pulse there.
Had anyone tried?
No, ma'am.
Was any equipment removed from the one trauma bag to help get his pulse?
No.
Had anyone made sure his airway was clear?
Visually, yes, but we didn't open his mouth, no.
Was Elijah responsive to pain?
Appeared so, yes.
Was he still being held down by officers?
Yes.
And he was handcuffed?
It appears so, yes.
During the time you were on scene up to this point, had Mr. McClain broken free from the officers?
No, not completely free, but it looks like they had to adjust multiple times to get him under control.
Had he tried to run into traffic?
Not that I saw, no.
Was he running around?
I never saw him stand.
What was your understanding in 2019 of the purpose of ketamine?
I know it was used for excited delirium sedation.
Okay. And was this a drug at that time as an EMT basic that you could administer?
No.
Only medics could do that.
Yes, ma'am.
Did you see defendants Cooper or Cichuniec do anything to address Elijah's concerns?
As far as what, ma'am?
Well, he had said he couldn't fix himself. Please stop. Please help me. What had they done to address his concerns?
Oh, I do remember. I'm sorry. Well, like I said earlier, it sounded like Cooper was trying to get them to not do whatever they were doing, and we couldn't see what they were doing, but it looked pretty aggressive by saying, let's just leave him here, and basically reassuring him that we had a plan.
What did they say to Elijah?
Our guys or the police?
Defendants Cooper and Cichuniec, what did they say to Elijah?
I didn't remember hearing them say anything.
At any point, did you hear, and I'm not talking about on video, but on August 24th of 2019, at any point did you hear defendants Cooper and Cichuniec discuss reasons why Elijah may be experiencing certain symptoms that he's having?
No, I wasn't privy to that conversation.
If we could please play, I believe this is actually a continuation of Exhibit 105, which is Officer Green's body-worn camera, beginning at 22:57:58, going through 22:58:16.
We'll do that.
Said 2 minutes out. Okay. All right.
We're trying to keep him on his side, dude, but he keeps fighting us, so.
Okay, so in this particular, where we've stopped here, those boots that we're looking at, do you recognize those?
Yes, I do.
Okay, and would those be consistent with AFR kind of fire medic
That's our crew, yes.
crew? Okay. And you're also all wearing those purple, or are they purple or are they blue gloves?
They might have been purple at the time. They're blue now.
Okay. And off to the screen to the right, is that the computer that you were talking about having brought to the scene?
Yes, ma'am.
Okay, and at this point, had you entered anything? Had you scribed anything?
I don't believe I did, no.
Okay. And did you hear an officer, Officer Rodema, ask Elijah if he was all right?
Yes.
And did you hear him kind of pat or slap him on the face prior to doing that?
I don't believe I did, no.
Okay, if we could replay that clip. I'm sorry, Your Honor. It seems we've lost the jury screen again.
Okay, can we stop for a second? Approach. We'll do that.
Said 2 minutes out.
Okay. You all right? We're trying to keep him on his side here, but he keeps fighting us, so.
He's breathing.
Thank you. Mr. De Jesus, what position is Elijah McClain in at this point in time?
Looks like he's rolled over on his left shoulder.
Okay, and is his right shoulder kind of pointed towards the ground?
Looks like it's kind of pointed up, not towards the ground, from my angle.
And do you recall Elijah McClain responding at all to Officer Rodima's question, "You all right?"
I didn't hear a response, no.
Okay. Do you remember hearing a response that night?
No, I just don't remember this particular scene. Sorry.
Okay, just one moment, Your Honor. So when you were on the scene, how clear of a view were you able to have of Elijah McClain?
It looks like from this angle, a very clear view.
On August 24th of 2019, and actually we can take this down. How clear of a view did you have of Elijah McClain?
Are you talking about in general or in that scene there?
During the time that you were on scene,
Mhm.
how well could you see Elijah McClain?
When lights were shined on him, very clearly.
And when lights were not shining on him?
It was dark, but less clearly.
And Your Honor, I'm about to start another section of questioning, and I know you wanted to break around 3:30.
All right, we'll take our longer break now, I suppose. Folks, we're going to take another break, but this will be the last for the afternoon, hopefully. And don't form or express any opinions or discuss the case. Do no independent research. Avoid any press coverage. We'll see you back in 15 or so minutes. All right, the jury stepped out. Please be seated. Anything before we take our break? No? Okay. All right, our jurors have come back into the courtroom. Please be seated. The court will recall 21 CR 2800, 21 CR 2806. Parties and counsel are present. Mr. De Jesus is on the witness stand, still under oath. You may continue with your examination.
Thank you, Your Honor. If we could please show Exhibit 105, Officer Green's body worn camera from 22:58:16 through 22:59:18.
Stop, dude, don't do it. We haven't even got that far yet, man.
Don't worry about what he's doing. He's like saying stuff and pulling his arms in, and he's like, I don't know exactly what that is.
My knee's on his elbow, dude. He ain't going anywhere.
Frank, do you release?
No, I'm good. I'm just gonna pat him down, make sure he doesn't have anything, because we haven't got to that far.
So just to the left of our screen, so by Officer Rodima's head, who was that standing in behind there?
Looks like Cooper there.
Okay, and who is it that has the light?
I believe that's Lieutenant Cichuniec.
And who's kind of standing here with their hands on their belt loops?
That looks like Austin Bradley.
Okay, and are you off to the side here on the right?
Yes, that's my hand.
Okay.
Far yet?
So pull him down while he's yes, he pulls his arm to the air. It comes out and I don't remember feeling it. Okay, so he comes down and it's here. I will.
Well, it is. Okay.
That's all.
I need, yeah, the truth's like that part.
So Mr. De Jesus, can you explain to the jury what's happening here when you're on scene on August 24th of 2019?
In this particular scene, ma'am?
And from your memory, what are we watching happen here?
It looks like the officer is holding him down with one leg and trying to pat him down. And it sounds like the ambulance had just arrived, if I'm not mistaken.
Okay, and you said, looks like, sounds like.
Yes.
The jury, to help the jury understand what's happening, you were there that night, correct? You're on this camera. And your perception and your perspective of what's happening in this scene, having been there while this was happening, is very helpful. So if you can kind of explain it to us from that point of view, as opposed to what we're all just seeing on the screen.
Like I mentioned, my memory is a little hazy. So I don't remember looking down from this angle, this scene right now. But from what I hear here, it sounds like the ambulance just arrived. It looks like Lieutenant Cichuniec has exited that scene to go talk to the ambulance, brief them on what we need.
And we heard Officer Rodima say, my knee's on his elbow, dude. He ain't going anywhere. Did Defendant Cooper take that opportunity to take a pulse?
No, ma'am.
Or check an airway?
Visually, he's at the head of the patient, so I believe he's checking the airway that way.
When Officer Rodima is conducting the body search or the search of Elijah, and when you were there, did you see him just kind of moving Elijah around as he wanted?
No, it appeared to me like he was reaching over the patient, not so much manipulating the patient to his hands.
Okay. And had you scribed anything on the tablet at this point?
To my knowledge and recollection, I don't think I did.
Okay. And for the next two clips, if you wouldn't mind focusing on Elijah's condition and helping us understand what's happening here.
Yes, ma'am.
And if you could please play Officer Green's body worn camera, which is Exhibit 105 from actually from right where we've left off here, 225918 through 230017.
Yeah, 500.
Don't do it. You're good. Nothing on his legs, right?
No.
I'm gonna come back this way. So we're not gonna lay anything else. Right in his puke.
Oh, thank you.
Here, come this way with it. Come this way. There we go.
What are you trying to get?
Just put his arm down here. And I could drop my knee right in his tricep. And then he can't move. And then he can breathe. Yeah. He can breathe. He can breathe. I just have his arm pinned behind his back. That's it.
Don't move your feet. No, don't do that.
So if you take his foot and angle it outwards
Yep.
and put pressure on his ankle.
So what were we watching at that point in time from your recollection on August 24th of 2019?
The police officers were patting the patient down. They had rolled him over onto his right side, pat him down, and it looks like from that point, it's hard to tell in the video and from my recollection, but they kept saying, "Don't do that." So it sounds like they kind of lost their hold on him for a second, or he was trying to move out of that. And then video ends there.
And did you hear the patient kind of, was he vomiting or moaning during that time?
I did hear moaning. I can't tell if he was vomiting though.
Okay. And if we can please play Exhibit 107, which is Sergeant Leonard's body worn camera from 2256-48 through 2257-27.
So I initially tried, and then I was in a bad position. I didn't want to hurt his neck, so I had to release because I was behind. I wasn't like.
So you went to put it on?
So it was like almost like a schoolboy trying to get in front of backwards.
Okay.
Because that was the only position I had.
Here, come this way, dude. Come this way. There we go. Put his arm down here. And I could drop my knee right in his tricep. And he can't move.
Make sure he can breathe. Keep it to the side.
He can breathe.
Okay, all right.
I just have his arm.
I understand, I understand.
So what were we seeing happen at this point in time?
That looks like the end of the last video we watched. They were keeping him on his left side now. The officers were making sure that he could breathe. Looks like Cooper was almost just knowing him. Looks like he was anxiously stepping towards the head and looking towards the ambulance back and forth because I believe ketamine was ordered at that time. So we were waiting for that to be drawn up, and that was the next step.
Did you see Defendant Cooper actually kneel down to check on Elijah McClain's airway?
I didn't see him kneel down. I did see him bend over the patient's head.
Did he say, make sure he can breathe?
Did Cooper say that?
Correct.
I did not hear that, no.
So it was an officer that was concerned about Elijah McClain's ability to breathe?
It was the officer that said that.
And did Defendant Cooper give any instructions or assistance to the officers on how Elijah McClain should be held in order to keep him safe in that situation?
No, they were keeping him on his left side, which is what we would have told him to do.
But it was officers that told him to keep him on his side?
It was the officers that were keeping him on his side. That is correct.
Okay. And is this EMT Basic Bradley?
Yes, ma'am.
Standing beside Cooper?
Yes.
Okay. You said that Defendant Cooper kind of stepped in and was looking for the ambulance. Did he shine a light on Mr. McClain to get a better visual of him?
No, again, I had my light shined on him the whole time. And that's typical that the medic would have his hands free and the other crew would shine lights.
Did he ask Elijah any questions?
Not that I heard there, no.
Do you recall him asking him any questions?
No, I don't.
And what did you notice about what Elijah was doing at that point in time?
To be honest, I don't remember too much from recollection. It would be from my watching of the video here, if that's okay.
Was he making noises?
It did sound like he was moaning or low yelling. Yes.
Do you remember him sounding like he was in pain?
Yes.
And at this point, is there a gurney near Mr. McClain?
I can't tell from that angle. I know it arrived shortly thereafter.
Okay. If we could please show Exhibit 105. This is Officer Green's body-worn camera picking up at 23:00:17 through 23:01:15.
He almost did a push-up with all three of us on his back.
Okay. Yeah, so once he gets out here, I'm gonna hit him in the right shoulder.
You want shoulder or ass?
Either way, just.
Ass is right here, man.
Okay. We'll give that a couple of minutes. We'll see if that works. And then if it does,
Yeah.
we'll go to bed. Just keep raising his legs.
You good?
Got it. Matt, you guys back away?
Yeah. Yeah.
I don't want to kick you, man.
No, we're good.
Yeah. it's over here.
Okay.
Who was it that said he's drawing up the ketamine?
I don't remember.
Was it defendant Cichuniec?
I don't know.
Sustained.
Could we replay starting at 23:00:28?
Okay.
Want to give that before we?
Yeah, so once he gets out here, I'm gonna hit him in the right shoulder.
Want some shears? You want shoulder or ass?
Either way, just.
Ass is right here, man.
Okay. We'll give that a couple of minutes. We'll see if that works. And then if it does,
Yeah.
we'll go to bed. Just keep raising his legs.
I apologize. I don't think I have my timing right, but we have additional video that we can go through.
Okay.
Is ketamine an injectable drug?
Yes.
And what did you do when you heard that ketamine was going to be drawn up?
I didn't do anything.
And at this point, have you and your team all been on the scene for about 8 minutes?
I'm not sure the exact time, but it could be right.
Okay. And other than that brief moment when we saw defendant Cooper kind of pull up Elijah's shirt to expose his arm, has anyone other than law enforcement touched Elijah McClain?
I believe so, no.
Has anyone other than law enforcement asked Elijah any questions?
No.
Where's the trauma bag that was brought to the scene?
Objection, Your Honor. Asked and answered.
At this point in time, where was the trauma bag that you had brought that had been brought to the scene?
That hasn't been asked and answered. It's overruled.
It's overruled, Judge.
Yes, it's overruled because it's a different question. But I will ask counsel to carefully read Rule 611A.
Thank you. Your
My
Honor.
idea of reasonable might not be yours.
At this point in time, where is the trauma bag that was brought to the scene?
I imagine it's still on the sidewalk, just I guess east of where the patient was.
And what about all of the other medical kits?
I'm not sure where they
I'm going to
were.
object. Speculation based on his prior testimony, and it's asked and answered.
Response.
Your Honor, I have not asked this question at this point in time. I'm asking where are the other medical kits at this point in time?
You can ask
for
him
this
if he
patient?
remembers where they are.
Mr. De Jesus, do you remember where all the medical kits are that were brought to the scene at this point in time for the patient?
I don't remember. No,
Where should they have been?
they're somewhere around the scene. I'm not sure if we have a protocol of exactly where they need to be in proximity to the patient.
Should they at least be close to the patient?
They should be close to the scene. Yes.
And is that to allow you to access the tools that you might need in order to treat your patient?
Yes.
Who communicated with Falk about needing ketamine?
Again, I don't remember.
Your Honor, if I may have just a moment. And I'm going to come back to that question while my colleagues find something for me.
Okay.
During the time leading up to what was going to be the administration of ketamine, what were you seeing your patient, Elijah McClain, doing?
Objection, Your Honor. Vague. Calls for speculation.
I'll overrule the objection if you can remember.
I mean, I can answer.
You may answer.
Okay. Again, with my memory being hazy, I know they were constantly telling him to, I believe, stop it. So it appeared he was trying to get out of the control that he was in. And that's what I remember of the situation.
Was he cursing?
I don't believe I heard any cursing.
Was he spitting?
I don't believe I saw any spitting.
Was he screaming?
I don't think at that time I heard screaming.
Was he throwing off the officers?
No, he was not throwing off the officers that I saw there.
Okay. And you have testified prior to today, is that correct?
Yes, ma'am.
And were you provided a copy of that testimony prior to today's hearing?
Yes, ma'am.
And you had an opportunity to review that testimony?
I did, ma'am.
What were you doing while you were waiting next to the patient for the ketamine?
I don't remember what I was doing.
Your Honor, if I may have just a moment.
Yes.
Your Honor, if I may have just a moment with counsel or with my co-counsel.
You may.
Thank you. Pursuant to the kind of what you're allowed to do between being an EMT basic and a paramedic, between the four of you on the scene, who would have been authorized to ask to draw up the ketamine?
Would be Cooper or Lieutenant Cichuniec.
And if I could please bring up Exhibit 105 at 230115 and just have you re-identify all of the medics and kind of where they're standing.
Okay.
Judge, I'm going to object at this point. We've identified everybody who's seen this. The jurors have been told.
That's one of those speaking objections, I think. What's your real objection?
This is improper impeachment or asked and answered. It's several.
Cumulative, Your Honor.
All right, I think he got it. Response?
Your Honor, in this particular scene, I'm asking the witness to orient the jury as to who is standing where so that we can understand who does what to treat the patient.
Judge, I still object. That's
All right, the court notes that the individuals were identified earlier in the video. This is quite a bit later, so I'll allow it.
And actually, it might be more useful if we played the video 230017 through 230115, and then we'll end up stopping it there, and I will ask you to identify who is standing where at that point in time.
Okay.
Thank you.
About the innocence around yourself. About the innocence around yourself.
He almost did a push-up with all three of us on his back.
Okay. Yeah, so once he gets out here, I'm gonna hit him in the right shoulder.
You want some shears? You want shoulder or ass?
Either way, just.
Ass is right here, man.
Okay. We'll give that a couple of minutes. We'll see if that works. And then if it does.
Yeah.
we'll go with that. He's raising his legs.
We've seen this exact same video and we don't even see it on a fireman.
Yeah, can we forward it to the place where somebody could be identified, please?
If we can please move it forward to 230100 and play through 230115.
Matt, you guys back way?
Yeah. Yeah.
I'm kicking you, man.
No, we're good. Okay.
Okay, so now can you please help us understand who is standing where at this point in the scene? And we'll start with who's standing over by the gurney.
Honestly, man, I can identify two clearly, myself and Cooper. The other two, it's hard without their faces.
And do we need to back up a little bit so you can, so as the camera goes up?
Yeah, that might help.
Okay, just back up maybe 5 seconds. And that didn't seem to help. So apologies for that. So that is you standing in the center, and that is Defendant Cooper
On the far
on
left.
the far left.
Yes, ma'am.
And then there's one medic standing right by the pram with a flashlight on.
Or a firefighter, could be Bradley. It's hard to tell.
Okay. So, but someone from your crew
Yes.
is standing by the pram, and then another person from your crew is standing directly to your right.
Yes,
Our
ma'am.
left. So how long had the gurney been on the scene at this point in time?
I'm not sure, ma'am.
And what are these medics and what were you doing for the patient at this point in time?
It looks like the patient was being prepped to be injected with ketamine. His shoulder was exposed, and again, medic Cooper's at the head.
And prior to the injection of ketamine, and we can take this down, thank you. Prior to the injection of ketamine, what did you do to prepare?
What did I personally do to prepare?
Correct.
I believe when the gurney got there, I repositioned myself to help get the patient ready to be lifted onto the gurney.
Did you prep any oxygen bags?
No, ma'am.
Did you prep the trauma kit?
No, ma'am.
Did you bring anything over to help assist with Elijah McClain's breathing?
I didn't bring anything. No.
Now, I would like to play Exhibit 105 from 2301:15 to 2301:57. And during this scene, in this portion of the video, I'd like you to tell the jury what's happening here. Keeping in mind that you were there on the night of August 24th of 2019, correct?
Yes, ma'am.
Yeah. And so that is what we would like you to do.
Okay.
Why sticking your head in that ambulance, make.
So I got his arm. Drag your knuckles right there. You don't have to put pressure until he moves. All right?
We got 500 to ketamine?
Yep.
Awesome, thank you.
Station 520.
Okay. All right.
Just rub it right behind his ear if he fights, all right?
Thank you. Prior to the ketamine injection, was Elijah McClain still in handcuffs?
Yes, ma'am.
And he wasn't really moving around, is that correct?
It appears they have him pretty well constrained there.
Okay. And we can see in this image that his fingers are kind of pointing upwards, kind of
Yes,
away
ma'am.
from his back. Would that be a good place to put a pulse oximeter?
On his fingers there?
Correct.
With how we're moving and having a needle, I think having a wired pulse oximeter with him moving is not the right call there.
What about after the needle is removed?
Then we're waiting for or for the drug to take effect. Again, having wires after a needle is injected into a patient, it's common for them to fight. I think having wires near a patient like that is also not the right time.
Okay, well, you just testified that he seemed to be fairly well restrained.
Yes.
So how would that interfere with having a pulse oximeter?
I think he was fairly restrained most of the call, but he still seemed to be able to wriggle out.
And earlier you testified that he was reacting to pain.
Yes, ma'am.
Do you recall him reacting to that injection?
I don't recall if he reacted to it, no.
And can you describe how his body was positioned when he got the injection?
Yes, ma'am. From the left shoulder, they rolled over a little bit so the right shoulder was facing us. They exposed the right shoulder, and that was where we were able to inject him.
At any point, was there a conversation about whether or not ketamine should be given to Elijah McClain?
I was not privy to any conversation of that nature.
Were you told at any point that there was a change in the plan?
No, ma'am.
And if we can please play Exhibit 105 from 23:01:57 to 23:02:52.
You always talk to the RP.
We'll give that a minute or two, see if that works, and once it is, we'll go ahead, if you guys are okay with it, we'll uncuff him, we'll go up with the right arm, down with the left, and we'll just restrain everything. We'll give that a minute or two.
All right. Hey, what you're, Rosie, here in a minute, once this medicine kicks in, we're gonna uncuff him, put him on the bed, and then we're gonna restrain him, soft point him to the bed.
No, you're okay. I got it.
Your Honor, may I have just a moment?
Yes.
Just a minute with. Your Honor, may we approach just for a quick moment? So, Mr. De Jesus, because of some of the issues we're having with you, I'm going to move to a different part of some questions that I wanted to ask you about what went on that evening.
Okay.
If we could please pull up previously admitted exhibit 282. This is the patient care report. And as a scribe for Aurora Fire, you're familiar with patient care reports?
Yes, ma'am.
You talked about them earlier.
Yes, ma'am.
Okay. And so I'd like to start at the top of this form with the incident time log. And we see there that it gives the name of the unit. Is engine 2, is that the unit that you were on that evening?
Yes, ma'am.
Okay. And it gives a dispatch time and an on-scene time.
It does.
Okay, and do you see below there, it says Medic 103. Do you know what that is?
That's our ambulance unit.
Okay, so that'd be Falk.
Yes.
Okay. And do you see that the times of dispatch responding on scene, are those fairly close in time?
Yes, ma'am.
Okay. And those times on this form, are they input or are they auto-populated through CAD?
I believe those are auto-populated.
Okay. And if we could go back to the full document and then go to this encounter portion. Okay, so it gives a time of first patient contact at 22:52:00. And that was approximately 2 minutes after arrival. Does that sound about right?
Yes.
Okay, so what are you doing between parking the engine and getting to the patient? What's happening during that time?
Gathering of the medical kits, my computer that I grab, getting together, walking to the scene. Some police officers met us before we actually entered the scene, as we saw in the videos earlier, and talked to us briefly. And then we went on scene.
And if we can now move to the treatments and assessments portion. And the first treatment and assessment that is listed is ketamine 500 milligrams. Do you see that?
I do.
And what are the sort of things that are typically listed in this treatments and assessments section?
Well, what you see here, anything given, so ketamine and oxygen were both given. Any procedures done here, like the OPA, blood pressure, the vitals were in there. And then when we restrained the patient, that's another procedure.
And do we see the time and it's running? Oh, did we lose?
Mine disappeared, yes.
Right. Is it back up on your screen there?
Yes, ma'am. Yeah. Thank you.
Okay. And the time column, does that appear to be in chronological order? So it starts with the first in time and then it kind of gets later and later as the time goes down?
It does, yes.
Okay, so the first thing in time is the ketamine.
That's correct.
And you mentioned oxygen.
Yes.
And that was given approximately, well, exactly 6 minutes after the ketamine was given.
On here it's listed as so.
Where was the oxygen administered for Elijah McClain?
Through a bag valve mask
Where was that located?
over his mouth and nose.
Was the patient still on the ground or was he somewhere else?
On the gurney.
And was that gurney in the ambulance?
I believe so.
And are bag valve masks and capnography things that you keep in your various medical kits?
Yes, ma'am.
Okay. And at 23:07, does it note that blood pressure was absent and heart rate is 0?
That's correct.
And is that around this, and is that kind of listed, it's logged at the same time as oxygen being given?
Yes, ma'am.
Okay. Now, if we could please move to the narrative section of the report. And how is this portion of the report entered?
This is entered typically when we get back to the station on a computer through whatever we have on the laptop that I had, gets sent over to this program that we use on our computers, and then we can type the report up there from memory and from what we have listed on scene.
Okay. And during that time that whomever is responsible for it on that call is typing this up, do they have an opportunity to kind of check with their other crew members to see if, like, if they can't remember something or if they need to add anything in?
Yes, we're all there.
Okay. And we can see on the left-hand column the letters SOAP kind of starting off each paragraph. Do you know what that stands for?
Yeah, it's a narrative acronym. I believe it's subjective, objective, assessment, and primary, if I remember correctly.
Could the P be plan?
Yes, I don't use SOAP. Apologize.
When you say you don't use SOAP, when you're creating a narrative, you don't use SOAP as your guide?
No, ma'am.
Okay. But you do create narratives?
I do.
Okay. Now, in the S section, this is the subjective, you said. And does this kind of provide the context for the assessment and the plan that's going to be put in place? Is that the purpose of the subjective?
Yes, and the information that we were given, things like that.
And here we see it says that there was a man running around with a mask on and not acting right. Do you see that?
I do.
And do you see anything in the subjective about a carotid hold?
I don't.
Is that something that could be important for deciding what your treatment plan might be?
Could be important, yes.
And why is that?
Any information is not bad information, I like to say, especially anything that the police tell you because they were on scene before us.
And when police are on scene before you and they give you a rundown, is that all you rely on when you're making decisions or assessing a situation, or do you do your own assessment upon arrival?
No, man, we do our own assessment.
And why is that?
Because that's where the medical portion of the scene. So as you can see, we're always within close proximity, looking at the patient, doing our own assessment there.
Okay, and for the O, objective, is this supposed to be what you learned by being on scene and encountering the patient?
Yeah, what we actually saw as opposed to possibly being told.
And is this where things like vital signs and physical exam findings would be listed?
Again, I don't use SOAP, but I would probably put that under A or possibly P.
Okay. But it would be included
Somewhere in there.
in a narrative.
The PCR, sorry, it's cutting out. In the PCR, there's more than a narrative.
Okay. Can someone tell if skin is cool through a visual assessment?
I believe you can tell if it's diaphoretic, which would lead to hot. There's certain indicators, but I don't believe you can tell the temperature unless you're looking through a thermometer. No.
And what cooling measures were done for Elijah McClain that evening?
The ambulance's clothes were cut off.
Prior to being in the ambulance, so from the time you arrived on scene to him being in the ambulance, what was done?
There was none that I saw.
And is the purpose of doing assessments and an objective assessment of what's happening at the scene to help determine what is our plan going to be.
Yes.
And for medics within AFR, does that help determine what protocol is going to be used?
Yes, ma'am.
Now, as an EMT basic, were there protocols that applied to you?
Yes.
Okay, and were there some that applied only to medics?
Yes.
And how did you know the difference between protocols that you could follow and protocols that only medics were allowed to follow?
Anything out of my scope, obviously, I wasn't allowed to follow. But if there were protocols that had both EMT and paramedic interjections, paramedics were colored, I think, light blue.
And when you say out of scope, what does that mean?
For example, injecting ketamine was out of my scope. That wasn't something I could do, even if, they told me to do it.
Okay, and then the P portion of this form, in this patient assessment, and this appears to be Lieutenant Cichuniec's kind of method for creating his narrative. And is there a requirement to do it? Oh, I'm sorry. I can still ask my question while this is being brought up. Is there a requirement to do it in that format?
No, ma'am.
So is it up to whomever's writing the narrative to put it in there?
Yes, ma'am.
And in a way that's useful for anyone who might be looking at the record later?
Yes, ma'am.
Okay. So for the P portion, this very first line, attempted to check patient's pulse, and we weren't able to due to him fighting and having handcuffs on. Do you recall anyone ever attempting to take Elijah McClain's pulse that evening?
I do recall Medic Cooper a couple times trying to take a step forward, especially when having a conversation about like, let's leave him be. And every time he would kind of step forward, it seems like he might have been cut off. I'm looking at the videos here. And I would, from my opinion, say that was attempting to get in there, but not able to because he was fighting and had handcuffs on.
At any point, was it communicated to law enforcement, hey, can we get in there and do an assessment of our patient?
Not that I heard, no.
Why wasn't Elijah McClain placed on the pram when it first arrived?
I don't remember.
Foundation calls for speculation.
Response.
If he knows.
All right, if he knows, I'll allow him to answer.
Sorry, say that question one more time.
Do you know why Elijah McClain was not placed on the gurney when it first arrived at his side?
I don't remember exactly when the gurney got placed by his side in relation to when the ketamine was injected. So I'm not sure how to answer that now.
Was the gurney at his side prior to the injection of ketamine?
As I just stated, I'm not sure when the gurney arrived in relation to the ketamine injection.
I may have just a moment, Your Honor. After Elijah McClain was injected with ketamine, how did he physically change?
He appeared to have stopped resisting the police. However, the police were still holding him. So it's hard to tell if he was not resisting or couldn't.
Were you hearing him make sounds?
I don't recall if I did or did not hear him make sounds after the injection.
May have just a moment, Your Honor. I need to find a specific spot in his testimony. And we can take that down if you'd like. Throughout your encounter or throughout your time on this scene, was Elijah McClain cooperating with law enforcement?
No, ma'am.
So it's your testimony today that he was not apologizing?
I think there's a difference between apologizing and cooperating.
And did you document that anywhere as the scribe?
I don't believe I did, no.
I apologize, Your Honor. I'm looking for a particular part and I don't want to get this incorrect. So, okay, so I want to go back to the time about thinking about immediately before the administration of ketamine and then immediately after the administration of ketamine.
Okay.
And I believe you testified that immediately before the administration of ketamine, he was still moving around while the officers were holding him on the ground.
Yes, ma'am.
And once the ketamine was administered, did he immediately change his kind of presentation as a patient?
I don't recall, especially if it was immediate.
Mr. De Jesus, prior to testifying today, were you provided a copy of your previous testimony
Yes, ma'am.
so that you could review it
Yes, ma'am.
and prepare for testifying today?
Yes, ma'am.
And did you have an opportunity to meet with opposing counsel?
I have, yes.
And have you watched videos with them?
No, we didn't watch videos.
You prepared for your direct examination?
Is this the direct examination?
Correct.
I feel prepared, yes.
Did they help you prepare for your
They
direct?
helped me, I'm sorry. No.
Did they help you prepare for what you might be expected to testify to on cross-examination,
No.
which is when they'll be asking you questions?
No. Just went over some of the stuff I said.
And so how long did you meet with them?
I want to say a half hour on a Zoom call or a Teams.
Okay, and did you also meet with my office
Yes, ma'am.
and myself
Yes, ma'am.
over a Teams call?
Yes, ma'am.
And did you understand that today you would be called to testify about what you observed and what occurred on August 24th of 2019?
Yes, ma'am.
I guess my question is, we've been watching a lot of this video. You were on scene that whole evening. Is that correct?
That's correct.
And this was a patient that cored.
Yes.
That's a pretty big deal, correct?
Yes, ma'am.
And why is that a big deal?
I think life is precious. Anytime someone dies, it's a big deal.
And so is this a call that sticks out in your memory?
Yes, ma'am.
Because it seems like a lot of the time when you've been shown video, you've had to say, I don't recall or I don't remember.
Yes, ma'am.
Objection, Your Honor. Argumentative. Counsel's testifying.
Sustained on both counts.
Thank you, Your Honor. If we could please show Exhibit 116. No, excuse me, 105, which is Officer Green's body-worn camera from 23:03:34 to 23:03:58.
All right. How's he? Does he seem a little?
Yep.
Okay, we'll go ahead and get him on his side and we'll just uncuff him.
Let's get him on the gurney first. Okay, if we can.
Okay. You guys with us in a minute? Careful,
Yeah,
careful.
he's definitely.
All right.
So what was happening in this scene? If you can tell the jury, what was happening here?
Objection, Your Honor. Video speaks for itself.
Response.
Your Honor, Mr. De Jesus is a percipient witness, and he's here to help explain to the jury what he recalls from that point in time. Not everything is captured on the video.
Well, that's not what you asked. Sustained.
Mr. De Jesus, did you assist in lifting Elijah McClain onto the gurney?
Yes, I did.
What part of his body did you hold?
I held his either shirt or pants there, it looked like.
Was anyone supporting his head?
I don't remember at the time. It looks like there are two people on the shoulders and the neck there.
When you're transporting or moving a patient from the ground to a gurney, is supporting a patient's head important?
Yes, ma'am.
And why is that?
Because oftentimes they can't support their own head.
Who was supporting Elijah McClain's head when he was being moved to the gurney?
Objection, Your Honor. Asked and answered.
Response.
I had asked him if he was holding Elijah McClain's head previously. So this has not been asked and answered.
The question, 2 questions ago, she asked who was supporting his head, and he indicated there were 2 people at the shoulders and the neck. That's the asked and answered question, Your Honor.
Response to that.
That didn't answer that was non-responsive because it didn't answer who was supporting his head.
All right, I'll overrule the objection on this one.
Who was supporting Elijah McClain's head?
It didn't appear anyone was supporting the head, just the neck.
And just prior to lifting Elijah McClain onto the gurney, we could see you lean in on this frame. Do you recall seeing that?
I do.
What were you doing?
I honestly don't remember. If we could replay that, that would help.
Well, actually, we don't need to replay it because
I'm going to object that the witness needs to replay it to refresh his memory. It's all on him, but we can replay it.
okay, we can replay to refresh.
All right. How's he? Does he seem a little?
Yep.
Okay, we'll go ahead and get him on his side and we'll just uncuff him.
Let's get him on the gurney first. Okay, if we can.
Okay. You guys with us in this?
Careful,
Yeah,
careful.
he's definitely. All right.
Did that help refresh your recollection?
It did, ma'am. Thank you.
So what were you doing when you leaned in closer to Elijah McClain?
First, I undid one of the soft restraints on the pram there, and then I was leaning in to see, as a group assessment, if the ketamine had kicked in.
And did you hear that kind of slapping sound?
I did.
And was that what was done to check and see if the ketamine had kicked in?
I don't remember that being done. I heard it on the video, but I don't remember who did it or why.
Okay, so you weren't outraged that someone had just slapped the face of Elijah McClain?
I don't believe they slapped the face, ma'am.
Did they pat his face?
Again, I don't believe they pat the face either. It sounds like they patted him on the back.
This is the gurney that came with the Falk ambulance, is that correct?
Yes, ma'am.
And this is the gurney, oh, excuse me, move past that. What equipment did you use that evening? And I'm talking about you in particular. What equipment, if any, did you use on Elijah McClain?
Is he in the ambulance relevant as well, or only before the ambulance?
We'll separate that. So before he gets into the ambulance, what equipment did you use on Elijah McClain?
I personally use no equipment.
Did you see anybody use any equipment on Elijah McClain?
The soft restraints on the pram is something we used on the patient, and the bed rest keeping his head in an upright position. Other than that, no equipment.
Okay, so the gurney?
Yes, ma'am.
Okay. If we could please play Exhibit 105. Oh, yeah.
All right, we're going to break for the weekend. One thing I've been made aware of is we're going to get the projector fixed, or a new projector, so we don't have to pause so many times. But please don't form or express any opinions or discuss the case even amongst yourselves. Do no independent research. Avoid any press coverage. Let me know if somebody tries to speak with you about the case. One thing I will note is, as we can see, this is a long trial, and it's very important that the jurors pay close and careful attention. And actually, I appreciated it when the juror raised his hand and let me know that he needed a break. And I would encourage the others to do so as well if that's the situation you get into. Because my experience is one person might raise their hand and then about 7 people end up using the restroom. So if that's something you need to do, feel free to do so. Other than that, have a good weekend and drive safely.
What's showtime on Monday?
What's that?
What the time we show?
Oh, I'm sorry. Oh, yeah, that's kind of important. We're going to be setting up the new projector either up there or perhaps down on the ground in the morning. We're going to let the folks in, the IT folks in at about 8:15, and we hope by 9:30 we'll be ready with the new projector. So 9:30. Thank you for asking. Jurors have stepped out. The witness, you may step down. You need to be back at 9:30 on Monday. Thank you. Anything before we take our break? All right. Well, the court sees it within its purview of Rule 611A not to allow filibusters. Good night.